is from Delhi and it is okay. Right.
Yes, they are not able to hear us. Huh?
They are unable to hear.
भैया जी क्या इशू है? We are उनको भैया जी बोलिए कि हम लोग सुन पा रहे हैं तो अपना प्रेजेंटेशन.
So are you able to hear me?
या आप भैया जी फोन करके बोलिए कि हम लोग सुन रहे हैं, प्रेजेंटेशन शुरू करें. को बोल दीजिए प्रेजेंटेशन.
Hello. Okay. So I'll start sharing the. I have a small PPT because I am not able to hear you. So वहाँ पर they are able to hear us. तो आपको अपना माइक्रोफोन और स्पीकर दोनों ऑन करके रखने हैं. तो आप अपना PPT लगा दीजिए. So
ये प्रेजेंटेशन वहीं से हो रहा है, कहाँ से हो रहा है? बस आ रहा है.
Sanitation as an issue. What exactly is the problem of sanitation? And we have been struggling with sanitation for a long time. So I don't know whether I am audible to you or not. So if somebody can confirm.
उनको बताइए.
Can somebody confirm? Not able to have that direction. Can video is not there. In this camera is it connected? No, we will wind it out to that. But this video is not connected. Can you do?
Yes.
So, friends, I'll briefly talk about what has been done with respect to sanitation and what is the future with respect to sanitation. So, this was the situation before 2014. Everyone knows. Next, please. So we were contributing in a big way to open defecation, and then we started the Swachh Bharat mission in 2014 and next year. So we started Swachh Bharat mission, and for 5 years we worked on Swachh Bharat mission, and we were able to convert all the red into green. That means we were able to convert all the villages in the country into open defecation free villages. So this is one achievement which we are proud of, but that doesn't mean that all the work has happened. There are still gaps in the country. We need to attend to those gaps. Even if let's say we have done 100%, that means we have just attended to the problem of open defecation. We need to go further. We need to ensure that nobody slips back, and we are also able to take care of the other works relating to solid and liquid waste management. Next, so we in 2019 achieved the status of ODF, that means open defecation free, which had a profound impact in terms of saving lives, health, saving environment, and also helping reducing the disease burden, also saving money, and also creating jobs in a big way. So next. So next, where do we move from here? So we have to take care of not only that whatever the status we have achieved, we sustain that next step. So we are able to take care of sustenance of open defecation free status, as well as we are able to take care of solid and liquid waste management. And generally we are visually clean. So this is a kind of typical artistic impression of a ODF plus village. So all the facilities with respect to toilets are there, and liquid waste management, cleanliness, wastewater management, everything, solid waste, liquid waste management, everything is there. Next, please. So some of the activities which happen, you can see, waste management is being done, plastic waste management is being done, and then waste stabilization ponds are also there in such villages. So we can classify a village as a ODF plus village. We have all the facilities with respect to solid waste management, liquid waste management, as well as general cleanliness, and we are able to sustain it over a period of time. Now, when this particular concept was evolved, there was commensurate money associated with that also. And in 2020, when the Union Cabinet approved the concept of ODF plus villages under the phase 2 of the national program. So, in the phase 2 of the national program, we were taking all those activities which were there in phase 1 and also solid and liquid waste management. So, the total project size became almost like about next please. So, total project size, next please. So we'll come back to these slides little later on. I'll just tell you about the total project size. So आगे चलेंगे आगे. So you know आगे चलें. Yeah. So total project size was about 140,000 crore. So which had the dovetailing mechanism for the budgetary provision as well as the 15th Finance Commission. So I hope slides are moving now and you are able to see that. But even let's say even if you are not able to see that, if you are able to hear me, I can say that when the whole project of phase 2 of Swachh Bharat Mission was envisaged, at that stage it was sort of a conversion and both the budgetary provisions from the normal budget as well as the 15th Finance Commission grants, which were immediately notified around at that point of time when our the cabinet note was approved or the concept was approved. It was envisaged that we'll be getting about 50,000 crores in the 5-year period. But later on, it turned out to be much more, and now we know that for sanitation alone, it is about 72,000 crores or so for the 5-year period, starting from 21-22 till 25-26. Now for the year 2021 also we had the provision, so all put together, it turned out to be a bonanza for the panchayat, and also for the first time, tide grants were provided for the sanitation related activities apart from drinking water activities. In the first year, 2021, 50% of the grants were for drinking water and sanitation, and in the subsequent years, that means for the full award, it was 30% for sanitation and 30% for yes.
तो वो लोग भेज नहीं पा रहे तो शेयरिंग पॉस्टर के लोग इससे कंफर्म जो करना चाहिए.
So I'm told you are not able to see, so we are just stopping and again I'm sorry, I don't know what is the technical issue here. Yeah. So I hope it is visible now to you. Let's say even if it is not visible, let me say that this whole program of Swachh Bharat Mission is based on convergence. All of you, particularly the people which are part of the Panchayati Raj institutions, both the elected representatives as well as the elected as well as the official network, the overall chain of command has done a tremendous work in the first phase of our work, which had begun in 2014. Sarpanches, pradhans, BDOs, and even the CEOs and the collectors, they had played a very important role. And we expect the same kind of work they will do in the second phase also. And in second phase, even though we had expected about 50,000 crore, as I was mentioning to you, it is much more than 70,000 crore for a period of about 6 years, 1 year plus 5 years. So now if we see the kind of money which is available, that shows the importance being given to sanitation, both sanitation as well as hygiene. And for that reason, Swachh Bharat Mission was started in 2014. And looking at the current scenario of COVID, everyone realizes the importance of sanitation and hygiene. And particularly in the last 1 year, keeping in mind the requirements of super hygiene in all the places, we had issued the guidelines that let's even if we want to use the 15 Finance Commission money or the budgetary provisions for sanitation related or hygiene related activities, you can use the money. Now, in this kind of situation, when so much of importance is being given to sanitation, there was a phase one in the form of Swachh Bharat Mission and phase two in the form of Swachh Bharat Mission, again with the focus on solid and liquid waste management. It becomes important that we also take advantage of the big opportunity which has been provided by by government in the form of the 15 Finance Commission. Now, when 15 Finance Commission money is there with you, now that means we need to work very closely with the panchayat like what we have been doing in the past. Now, new provisions have come into force, new guidelines have come into force, which you would have heard in the morning also, that we need to have regular meetings of the panchayats. We need to place all our plans before the panchayat, and we need to record them in the GPDP also. Then only you will be able to use the money, and then only you will be able to record its expenditure and record the accounting, the audited statement of account on UC also. Now, in this kind of situation, it becomes very important that all of us are aware of the whole mechanism to begin with, and we are also aware of the e-Gram Swaraj. E-Gram Swaraj, I suppose people will be discussing it. There will be presentation on that. It's an online platform wherein you can have end-to-end solution. The planning as well as the other activities can be shown there. Now, just to complete my earlier point, this is the kind of money which is available. And just to show you, I'll complete these slides which are there. This will be useful for you to get an overall picture. So this is the kind of money which is available from 21-22 to 25-26. Next. So we have. Just to, there was a point when we were discussing with the states that all the states were saying that the Panchayati Raj institutions, they are not listening to us, and they are saying that they will not undertake activities of just sanitation or drinking water. They will undertake activities based on their needs. So that is what we are also saying, but we have provided a list of sanitation related activities which can be undertaken at the field level, and both at the GP level, block level, or maybe at the district level. We have provided exhaustive list of sanitation related activities, and we have also provided the written guidance note to all of you, which are available in the link which I'm just sharing it here. So we have a lot of slideshow about it, Ali.
So, thanks a lot, sir, for your very nice presentation and quite exhaustive. And
yeah, so we have a lot of material with respect to the new provision. We have provided phase 2 guidelines. We have also the technical manuals which are available in our website. And we have recently, for the utilization of 15 Finance Commission money, we have made provisions, and we have allowed these to be given in black and white. It's called slideshow, it's not sharing the video. So we have now. I don't know whether I am visible to you or not. Why my camera is off? दो बार आपने शेयर किया हुआ तो we try to इसको काट दीजिए.
Thanks a lot, sir, for your very comprehensive presentation, and I think all the participants here, they will carry it forward.
We have tried to simplify the provisions. We have tried to convert it into a manual, and we have shared it with everyone. Hopefully, it will be useful, and we will be able to make good for all these provisions while implementing the scheme in the Well, I'll just stop here because I'm not getting any sense because I'm just feeling that I'm just speaking to nobody. So I can't see anyone and I can't, since I'm getting message from Narendra Kumar that you are able to hear me. So I'm speaking, otherwise I really not able to make any sense of whether I'm addressing to people or not. So I'll just stop here. If you have any questions or anything, you can just add it add here in the chat box or whatever you want to do.
Thank you, sir.
So that will be,
Sir, we'll share this on the chat box because
I'll try to hear it or I'll see in the chat box.
In the chat box, I think.
I'll just stop here.
Okay, thank you, sir. Okay, now I will request Manish Garg from the Ministry of Education to share his to make the presentation on Sarv Shiksha Abhiyan and how the panchayats can really play a meaningful role in that. So.
A very good afternoon to everyone.
I hope.
A very good afternoon, everyone. Worthy Secretary, Ministry of Panchayati Raj, DG NIRD, senior officers on the dais, and colleagues from the states. First of all, I'd like to thank Ministry of Panchayati Raj for inviting me for this workshop, which is very crucial from the point of view of not only the panchayats, but also the education department. I have a longish presentation, but I'll try to rush through in view of the short time available. This is the broad situation in the country, the number of elementary schools. We have availability of primary and upper primary schools within 97% of the habitations. And the number of teachers and the PTR are also satisfactory at the national level. The gross enrollment ratio at the primary level is very good, but it drops at the upper primary level and then it further drops at the secondary level. So this is the secondary level data. We have the schools within 5 kilometers of 95% of the habitations, and total enrollment is about 3 crore 83 lakhs. I won't like to bore you with the data. The gross enrollment ratio, which drops to 87% in upper primary level, drops to 77% in the secondary level. So that is something we need to work on. And consequently, the transition rate from class 8 to class 9 is also about 90%. Although the gender parity ratio is good for the time being. At the senior secondary level, 90% of the habitations have a school within 8 to 10 kilometers. Then most of the schools are actually in the government sector and a few in the aided sector, and about 26% schools are in the private sector also. I think there is some, here it is okay. Now, before going into the convergence, I'll just like to tell you about the major flagship program of the Department of School Education, which is Samagra Shiksha. And this is an integrated scheme right from preschool to senior secondary level, which was launched in 2018-19. And the scheme is in accordance with the Sustainable Developmental Goals and now also has been aligned to the National Education Policy 2020 and extended up to 2025-26. And the scheme pays a special emphasis on educationally backward blocks, LWE districts, SFDs, border areas, and aspirational districts. Of course, it is applicable throughout the country, and each and every school is covered under the scheme. Now, some of the major interventions and components of the scheme, I hope you are able to see. These are the, Samagra Shiksha is a centrally sponsored scheme in which funds are given on an annual basis to the states in the same 60-40 ratio or 90-10 or 100%. And these are the various interventions that we support under the scheme based on the annual work plans of each state approved by a project approval board chaired by the Secretary, Department of School Education. And the states upload their plans on the online Prabandh portal, and the plans are appraised online itself, and then the meetings are held and the plans are approved. Of course, the access and retention is based on the gaps that are identified through the UDICE Plus data. You may have heard of the UDICE Plus data, which carries a database of each and every school of the country. Nearly 15 lakh plus schools are currently mapped on the UDICE Plus data, and about 25 crore children and about 90 lakh teachers data is available there. Besides the access and retention, we also provide certain RT entitlements, which are the child-based entitlements like free uniforms, free textbooks, transport, escort facilities, etc. Then capacity building of teachers and SMCs, SMDCs, and PTA. We have the concept of the School Management Committee as mandated by the Right to Education Act. Defining various standards with respect to the learning outcomes, conduct of the national achievement surveys, performance grading index for grading of states and as well as districts. Various quality interventions are also supported under the scheme. I won't go into each and every one, but you may look at the support at preschool level that we have started under the scheme for the very first time. Foundational literacy and numeracy is gaining more and more importance as per the national education policy. Every school is supposed to have a library, annual grant for libraries and sports, equipment, as well also the other quality initiatives. Composite school grant is provided to every school from based on the enrollment of the school, ranging from 25,000 to 1 lakh per annum. Strengthening of teacher education institutions such as SCRTs, diets are also supported. Then various initiatives for bridging the social and gender gaps are undertaken. Inclusion of children with special needs is a major focus area. Vocational education at secondary and senior secondary level, and also now vocational exposure at the upper primary level as per the national education policy. And community participation and holds an important aspect. Data capturing through UDICE Plus and Prabandh, and various monitoring tools and instruments are used. We are going to introduce social audit from this year, and we are preparing the guidelines for social audit in collaboration with NIRD only. These are some of the convergence that we are doing and which needs to be taken forward also. First of all, provision and maintenance of certain basic amenities in schools like toilets and drinking water facilities, hand washing facilities. Major minor repairs, flooring tiles, blackboards, hand washing facilities, playgrounds, and boundary wall have been allowed under the MNREGS scheme by the Ministry of Rural Development. And then also providing the technical support for implementation of construction activities. Since some other departments are also here, we had put some slides on convergence with the other departments like ICDS of Ministry of WCD, then Ministry of Drinking Water and Sanitation. We are collaborating with the Swachh Bharat Mission. Then Ministry of Labour has the National Child Labour Project for rescuing and mainstreaming of out-of-school children, the rescued labourers, and of course residential facilities for SC/ST children in some areas. Department of Health and Family Welfare, for the children with special needs, we have made a provision for an annual camps at the block level for identification of children with disabilities. And that will be done in collaboration with the Department of Health and Family Welfare and also the Department of Social Justice. Provision of sanitary napkins, regular health checkups for students under the Ayushman Bharat and school health program. Distribution iron, folic acid tablets and deworming tablets, and medical support for COVID-19 response as well. And then with the Ministry of Social Justice and Empowerment, we are collaborating for providing the aids and appliances to children under their SIPDA scheme. Of course, we provide part of the funding and they also provide part of the funding. This I'll skip as there is no department represented here. Now, the future scope of convergence. Firstly, we have the National Education Policy 2020 has come out last year. So I hope people here also must be aware of that. Can we just see how many people actually know that the National Education Policy 2020 has come, with a raise of hands, if I may exert you a little?
That's good. At least
so not
50% people are aware.
but still not many people,
Not many.
given the kind of
Yeah.
outreach that we have attempted under the NEP. Still only about 50% people actually know that NEP has come, but they may also not be aware of the provisions. We envisage that we may hold meetings at different levels, so that the different levels of the Panchayati Raj institutions, they understand the national education policy and their role in it. Actually, the NEP talks very clearly about the role of the Gram Panchayats and the local bodies and community participation. So these are some of the items that, some of the agenda that the Gram Panchayats tend to take forward based on the national education policy. And I'll request all of you to tie up with the education departments and hold seminars and workshops for your Panchayati Raj representatives on the national education policy and the Samagra Shiksha scheme also, so that everyone is aware of this and their role in the implementation. So some of the things that can be targeted by the Gram Panchayats are ensuring 100% enrollment of all children at appropriate levels, strengthening school infrastructure, ensuring zero dropout and no out-of-school children panchayats. Some kind of a campaign of zero dropout can be undertaken, like Jharkhand had undertaken a campaign on zero dropout panchayats. Making the school environment inclusive and non-discriminatory, ensuring the safety of children in schools, and volunteering and monitoring of learning outcomes of children, especially the foundational learning. Another important aspect of the NEP is that children should have opportunities to undergo internships with the local artisans and with the self-help groups, and also with the local offices that are present. Children can even intern with the Gram Panchayat for a few days, or with the other offices present in the Panchayat level. So those kind of internships can be facilitated by the local bodies. Then the school, every school has to prepare a school development plan by the SMC or the SMDC as per the Right to Education Act. And that the school development plan may be converged with the GPDP through the village education committees. Because one panchayat will be having about, say about 5 schools at least. So the village education committee can coordinate and get all the school developmental plans and make it a part of the GPDP. Then conduct of a social audit of schemes, that is where they can collaborate. The cleanliness on schools, because once the schools are constructed, there are actually, and the toilets are also there, there are actually no funds available for cleanliness or for maintenance, and here the panchayats can contribute in a big way. And I think many states have also deployed cleaning staff. Many panchayats have also deployed, but they are on intermittent basis. Training of local village level workers can be undertaken. Then construction, maintenance of basic amenities in school, I'd like to give an example of UP where under Operation Kayakal, the entire the schools have been transformed as far as their outlook and their environment are concerned, including using the funds from the Gram Panchayats only. And various other states are also doing that, like Tamil Nadu, Madhya Pradesh. They have a very active collaboration where the panchayat are helping in maintenance of the school sanitation and hygiene. Then counseling and awareness campaigns can be run to reduce dropout and to bring out of school children into school. We have been going through a pandemic and we are realizing that large number of children do not have access to digital devices. So the local bodies can actually also help in creating some mobile banks and facilitating pairing of the children with devices and without devices, promoting community-driven education, then supporting mobile schools, facilitating mapping of children of migrant laborers, and ensuring that they get admission into schools and out of school children as well. Then creating awareness among the parents regarding learning outcomes for students. I'll just come to the Nipun Bharat mission later on. And provision of the sanitation and cleanliness facilities in school as a result of the COVID. Various panchayat bhavans have been used as learning centers because they are having some facilities for digital facilities, or some television is there. So children are able to come there and view the classes during the school closures. Then village schools can also be used for, like Secretary Sir was mentioning, even during the off-school hours. When the school is closed, the school premises can be used for various skilling programs, linking of out-of-school children, or even for the supplementary classes, or adult literacy. Those premises can be used. And under the midday meal, the local community can be involved to make various provisions. The various states are also using the self-help groups for distribution and stitching of school uniforms. And another idea that has come is that some leftover cloth from uniform can also be used for stitching COVID-19 masks and giving to children. Telecom department, of course, is not here, but of course at the local level it can be arranged, electrification and internet connectivity to schools. Training of teachers, SMDC members can be done regarding the COVID-19, the Department of Health and Family Welfare. And of course, we are giving an annual sports grant, but the identification and nurturing of children needs to be done. And we are encouraging every school to have a school kitchen garden. So there the Gram Panchayats can also collaborate. And it not only provides experiential learning in various fields like maths, botany, knowing about plants, seeds, growing seasons, but also provide some supplementary nutrition to the children. Now, this is a Nipun Bharat mission has been launched on 5th of July 2021 under Samagra Shiksha scheme itself, and it focuses on foundational literacy and numeracy, which has been identified as one of the major pillars of the national education policy. And it has been envisaged that this is the most important aspect of education in children who are not able to do the basic reading and numeracy by the age of 9 or by class 3. Then they tend to drop out and their learning outcomes in the later stages drop very sharply. So this is the area where we need a lot of focus. And under the scheme, we have prepared very detailed codification of learning outcomes. Of course, that is for the teachers. But for the local representatives, we have prepared lakshyas or targets under the scheme, which are very easily understandable and they can be disseminated to everyone in the Gram Panchayat. These are things like the child of class 3 should be able to read from an unknown text about 60 words per minute. So that's all. That's all the Panchayat representative, anyone going to the school has to see whether the children are able to read from unknown text fluently and perform basic mathematical operations. This is, of course, the vision of Nipun Bharat mission. I'll just go to the next. Role of volunteers, we are envisaging in community. Yes, just 2 minutes. Community involvement and organization of school readiness melas, Gunotsav, Praveshotsav for children. These can be organized by the panchayats. And of course, facilitate baseline analysis to identify the struggling learners and status school-wise, ensuring 100% enrollment, zero dropout. Connecting volunteer parents to schools to help the school achieve the FLN goals. So, panchayat can have a target that all children in our panchayat achieve these FLN goals. That kind of a targets can be established. Then another major program is the adult education, in which the collaboration with the Ministry of Panchayati Raj is being envisaged, and of course this scheme also is being extended now for the next 5 years. So here the various outreach activities can be undertaken for identification of adult learners, extension of local libraries, and identifying the target persons and voluntary teachers. So these programs can also be targeted. Of course, it is all need-based, based on the assessment of the local situation by the panchayat. Social audit will also be undertaken, and the local resources can be made available for providing the adult education. This is just a small on the Vidyanjali 2.0 program has been recently launched, which is a school volunteer program, wherein any person, any individual, any organization can come in to collaborate and to contribute to the school development, either in kind or in through services. So you can also, all of you can also volunteer to provide your services in one school or two schools as you deem fit. And role of volunteers cannot be overemphasized. This is very important. This is the detail. Of course, you can go to the portal Vidyanjali 2.0 and register yourself as a volunteer, or anyone can do that. Now, this is what the MOE can also offer, that as we have been discussing, the space in SCRT's diets can also be used for various training programs, capacity building by the MOPR or MORD as per the availability of the resources or during the off hours. Teachers can be used as resource person. Of course, I won't encourage too much that, because the academic time also gets lost, as it is the teachers are busy in many things. But we have the block resource centers and the cluster resource centers, and some resource persons can be called from there for the orientation of the PRIs, mainly on education. So let's all join hands to create a sustainable schooling environment for our children and greater effectiveness of all schools. Thank you very much.
So thanks, Manish. Actually, I must apologize, because see, these sessions, which is so important in itself, education, health, giving 15 minutes, we're really not doing justice. Actually, if we can do this in 2 days program, then only we could have justice, because each day need 1 hour session. So I really feel sorry, education, health, livelihood, but every program we are discussing, Swachh Bharat and all, they need just 1 hour each to really make some. But what I will do, because the time is running short, and the people who have really good questions and some really, they have some issues, kindly email us. Kindly email us. And if you really, I will invite just one question and some really important, if somebody has really good feedback to give, kindly just one question I will give. But kindly, of each session, if you have really good question, appeal, feedback and all, kindly share in email. So all participants. So any one question I will just invite before I. I think वो तो बताया काफी, देखिए GP
हाँ, जो ये बेसिकली आई थिंक वर्कशॉप इसीलिए है कि डिफरेंट लाइन मिनिस्ट्रीज का क्या रोल हो सकता है GPDB में, एंड ऑफ कोर्स जो हम लोग ने प्रेजेंटेशन में भी दिखाया मैंने, एक स्कूल डेवलपमेंट प्लान हर एक स्कूल का बनता है, जिसको आई थिंक इंटीग्रेट किया जा सकता है GPDP के साथ. ऑफ कोर्स स्कूल डेवलपमेंट प्लान बनता है तो उसके रिसोर्सेज का इतना आइडिया नहीं होता उस टाइम स्कूल को, because वो फंडिंग के लिए it goes to the state and then to the समग्र शिक्षा to our scheme, और हम लोग जो gaps identify होते हैं उसके हिसाब से उसको assess करते हैं whether the school is actually eligible for that funding or not. But उसको integrate किया जा सकता है with the ग्राम पंचायत development plan also. और उसमें जो गैप्स हैं, जैसे जो लोकल लेवल पे फिलअप किए जा सकते हैं, जैसे स्पेशली इन एरियाज ऑफ सैनिटेशन, हाइजीन, हैंड वॉशिंग, ड्रिंकिंग वाटर, वो 15 फाइनेंस कमीशन फंड से भी उसको यूज़ किया जा सकता है, बिकॉज ऑलमोस्ट एवरी पंचायत इज़ गेटिंग अबाउट 90 lakhs in 5 years on an average as part of the finance commission award, which is about 18 lakhs per year. So I think I'll request some of that to be used for the sanitation and hygiene and drinking water and hand washing facilities in schools. Thank you.
इनका मैडम का भी एक सुझाव है, आप एक जो बोलना चाह रही हैं।
सो एक तो बता दिया सर ने क्या है, दूसरा है कि जो हमारे जो VPRPs आते हैं, विलेज पॉवर्टी रिडक्शन प्लान, उसमें काफ़ी कुछ हो सकता है स्कूल से रिलेटेड, स्कूल के इंफ्रास्ट्रक्चर से रिलेटेड, टॉयलेट्स, सोशल डेवलपमेंट प्लान में स्कूल के ड्रॉप आउट्स के बारे में। सो वो जो GPDP में इंक्लूड करके एजुकेशन डिपार्टमेंट को पास ऑन किया जा सकता है कि ये चीज़ें इस पंचायत में करने की ज़रूरत है, और कुछ बजट भी अवेलेबल है पंचायत में, सो दैट कैन बी वन एस्पेक्ट।
हाँ बताइए।
इसमें एक बड़ा जो हम पहले भी कुपोषण की बात कर रहे थे, मिड डे मील स्कीम एक बहुत बड़ी स्कीम है, और हमारा अगर फ्यूचर ही बच्चे हैं, इफ़ वी आर एबल टू हार्नेस दैट थ्रू द मीडियम ऑफ स्कूल्स, नॉट ओनली हेल्थ बट ऑल्सो कॉस्टिंग ऑन हेल्थ, आगे जाके ये जो ड्रॉप आउट्स हैं, जो हम उस पर पैसा दूसरा वो लगा रहे हैं, वो भी कम होगा। दैट इज़ अनदर एरिया वेयर इट कैन बी यूज्ड। देन आपका जो स्किल डेवलपमेंट की बात हो रही थी, देयर इट कैन अगेन बी यूज, जो फैसिलिटीज़ ये बता रहे हैं, जो बहुत बढ़िया जय साहब ने बताया, देख इट कैन बी यूज सब्सिक्वेंटली, आपकी बिल्डिंग खड़ी रहती है, वो जितनी बार यूज़ करेंगे, बिकॉज वो टाइम जो निकला दैट इज़ द मनी। आज के अगर 6 घंटे खाली चला गया तो खाली है, वो तो खत्म हो गया। इफ़ यू कुड यूज इट perhaps it will make a difference.
इसमें अभी बिकॉज मैं भी बोल रहा था कि वी आर नॉट एबल टू डू जस्टिस हियर 15 मिनट में, तो जब रीजनल कॉन्फ्रेंस करेंगे तो इसको हम लोग ध्यान रखें कि इस पर कम से कम 2-3 घंटे का रखें, और सारी क्लैरिटी लोगों को दी जाए कि एजुकेशन, हेल्थ, सैनिटेशन, ड्रिंकिंग वाटर पे कैसे GPDP में जाएगा, बिकॉज ये नेशनल लेवल कॉन्फ्रेंस हो, ये 15 मिनट पैक किया गया है, बट ये सारी क्लैरिटी जब हम लोग रीजनल कॉन्फ्रेंस में जाएंगे तो वहाँ पे इसको जब स्ट्रक्चर करेंगे आप लोग प्रोग्राम, कम से कम इसको कम से कम 1-2 घंटा दीजिए हर एक सेशन को, नहीं तो वो जस्टिस नहीं हो पाएगा।
Just one thing I like to add कि GPDP में I think only infrastructure may not be covered, but as has been said earlier, services may also be covered, like रेखा जी ने भी बताया कि आउट ऑफ स्कूल चिल्ड्रन, सो एवरी पंचायत को एक कुछ विजन देना पड़ेगा कि मैं अपने इस साल जो है आई इंश्योर कि हर बच्चा स्कूल आए, या हर बच्चा जो है वो फाउंडेशनल लिटरेसी के टारगेट्स अचीव करे। तो ये चीज़ें भी अगर उसमें GPDP में जाए तो आई थिंक इट विल बी मोर होलसम काइंड ऑफ प्लान।
बोला कि अभी पंचायत का अपना डिलीवरेबल होना चाहिए कि 1 साल बाद वो क्या है। हाँ जस्ट मिनट, एक बस आधा मिनट से ज़्यादा का टाइम नहीं है ना, नहीं तो आपका लंच मिस होने वाला, मैं बता दिया हूँ।
सर जस्ट वुड लाइक टू रिक्वेस्ट कि whatever your source envelope is for the education department, that should be shared with us in the Panchayati Raj department during this ongoing GPDP campaign. Suppose if you are giving your plan or if you are asking for the funds later on, then we may not be able to integrate those into the plans. So it will be taken to the next year. So this year itself, during this campaign period itself, you should be telling us your source envelope.
लेकिन देखिए वो आपका व्हाट इज गुड नेम
जितेंद्र
सिंह जी, वो होगा स्टेट लेवल पे, आपको डिस्ट्रिक्ट लेवल से वो कराना होगा। इनके ये तो चिट्ठी लिखते ही रहते हैं, लेकिन जब तक आप डिस्ट्रिक्ट लेवल पे उसको इंश्योर नहीं कराएंगे वो नहीं आएगा उनका। प्रियंका यू वांटेड समथिंग, जस्ट हाफ अ मिनट।
Sir, the only thing that we request is we have primary schools at every village, at every Gram Panchayat. During the GPDP process in the Gram Sabha, if the headmasters are present in the Gram Sabha, that also helps in prioritizing the activities in the schools. So he could also feed in his, as you said, the school development plan. So that thing can also come.
So now because somebody next speaker has to catch his flight, so I will I know there are, see I beginning I told we are not doing any justice with the way we are So each is such a important programs we need to give 2 hours each, but 15 मिनट ये अब रीजनल कॉन्फ्रेंस हम लोग देखेंगे कि कम से कम इनको 1.5-2 घंटा एक सेशन को दिया जाए, क्या कि इसमें आई थिंक सो नेक्स्ट स्पीकर मिस्टर सीपी रेड्डी, डॉक्टर सीपी रेड्डी जी हैं जो मिनिस्ट्री ऑफ लैंड रिसोर्सेस हैं. आई रिक्वेस्ट काइंडली प्लीज मेक अ प्रेजेंटेशन.
Respected Additional Secretary and Panchayat Raj and Chairman of the session, and respected Joint Secretary, senior colleagues on dais and friends, very good afternoon to all of you. And I am speaking on behalf of DOLR. We are implementing watershed development component of Pradhan Mantri Krishi Sinchai Yojana. And many of you may be aware of this is the one of the scheme which was empowered the panchayats in implementation both physically and financially way back in 2003 by necessary revision in the guidelines. Since then, panchayats are fully involved. They are the implementing agencies at field level. How I am just giving you a brief about the scheme, how panchayats are involved in the planning, execution and post-project maintenance of the assets in the watershed programs. Next. And just I want to briefly explain you, there is a strong nexus between land degradation and drought, rainfed and poverty. This is the simple slide, I have made it and it is self-explanatory. I don't want to waste time on this. And watershed management is considered as one of the important program which can improve the soil management, land management and livelihoods in the degraded and rain-fed areas. Next. All right, you just next, please. So simply rain-fed agriculture, just I want to give a brief information about many participants, and because you may not be aware of, still more than 50% of our cultivated area is depending on rain-fed, and 40% of the people and 2/3 of the livestock depends on these rain-fed areas. 84% of the rural poor are living in these areas. Yet rain-fed areas contributes 40% of the food grain production, especially oilseed pulses are mostly coming from these regions. And the per hectare yield is very low in the rain-fed areas, basically because of lack of moisture, which creates many issues and low productivity. Next. So the rain-fed agriculture major problem is that the soil lands is degraded one, and diverse climate, poor economic condition of the farmers, low productivity and low vegetation. These are the important problems which are being addressed through watershed development program. Next. So what is watershed? People generally think that watershed means some kind of water harvesting structure. That's not the issue. Watershed is a geohydrological unit which drains into common pond, which is taken as an approach for the development and taking various initiatives following ridge to valley approach, which is a basic platform. You can treat it as a hardware, and many developmental programs can very well fit into this, like horticulture mission, micro irrigation, various other activities can very well fit into this. Next, please. So basic features of our watershed is, our program is having the dedicated institutional sectors at various levels. At central level, we have a department and steering committee. State level nodal agency is there with multidisciplinary support. And district level, we have watershed cell cum data center chaired by collector or Jilla Panchayat CEO. Project level, we have project implementing agency. Village level, we have a watershed committee, which is the cutting edge institute where this watershed committee, I'll explain in detail how watershed committee important for this implementation of program at ground level. Our projects are average size is 5,000 hectares, which may cover 2 to 3 gram panchayats. And the cost norms is 12,000 per hectare in the plain areas, 15,000 at difficult areas. This has been revised for next generation projects, which will start from current year. Then funding pattern is 60-40 and 90-10. Then the project period 4 to 7 years, and now in the next generation, this project period has been reduced to 3 to 5 years. Next, please. The important features of watershed is it is totally participatory approach is followed, implemented by the community, and then main emphasis is our participation in their plans. There is no pressure from state level and district level. Everything is planned by the watershed committee. Then contributory approach is there, transparency in transaction. Funding is directly provided to the watershed committee. All the work component of the project, it is more than 70%, goes to watershed committee for implementation of the project. Then demand driven and linkage with various research institutions, flexibility in technology, etc. Next. The activities generally we start the establishment of the village level institutions, then capacity building, then the encouraging the participation and the formulation of the plans, various water harvesting structures, forestation, horticulture, and farming systems approach is followed depending on the location. These are decided by the community. Next. This is the cutting edge institution available under watershed. This watershed committee is constituted by the Gram Panchayat, Gram Sabha, and we have given two options in the guidelines. One is the committee is a registered society, or it may be a subcommittee of the Gram Panchayat. And the members will be SHGs, UGs, and Panchayat members will also be members of this committee. They are the planners, selection of activities, executors, payments, post-project management. Rest of the institutions are only facilitating. That is the importance which we give for the Gram Panchayats, and they are implementing the watershed projects. Next. The role of Gram Sabha is to constitution of watershed committee and appointing the chairman and secretary. And secretary is a paid functionary from the watershed, and they approve the program, detailed program reports, and they also facilitate the functioning of the watershed committee. Next. Then the role of Gram Panchayat is Gram Panchayat provide accommodation for watershed committee, supervise, advise the watershed committee, authenticate all the accounts. They are answerable to the watershed committee is answerable to Gram Panchayat and Gram Sabha. Basic function of the Gram Panchayat is facilitating the convergence of various schemes like NREGA and other important schemes, relevant schemes. Post-project maintenance of the assets created in the community lands. Then they also usufruct rights sharing, etc. is looked after by the Gram Panchayat. Collection of user charges. These are all given to the Gram Panchayat. They are all provided in the guidelines. Next. Then the strategy, social strategy is participatory approach, demand driven and equity issues, and flexibility in technology, strengthening of the community. No activity is fixed from center or state. It is all decided by the community itself, watershed committee itself. Next. Then the technical strategy is we have to ensure the ridge to valley approach and in situ moisture conservation, runoff, reducing runoff. Basically, the structure should be depending on the water budgeting and the farming systems approach. And ultimate motto is Ket ki pani ket mein, gaon ki pani gaon mein. This is the motto which we implement watershed. Next. Then the convergence is a policy decision, and necessary guidelines have been jointly issued by the Rural Development and the Department of Land Resources, and convergence has been emphasized, and we have also improved the convergence. Earlier we used to get 18% of the expenditure watershed from convergence. Now it has been improved to 26%. There is going on, still it is an area where improvement is required. The convergence is one of the concern for all of us, yet there is a need for improvement in the convergence with relevant schemes. Next. The present status of watershed is we have completed about 80% of the project. 1,000 plus are yet to be completed. This is the terminal year. This year they all have to be completed. Next. Then so far we have constructed 7.5 lakh water harvesting structures and 16 lakh area brought under protective irrigation. 34 lakh farmers got benefited. 3.5 crore employment generated. 3.2 lakh hectares of the wasteland developed. And next. Okay. And these are some of the significant improvements reported by the third line, end line evaluation reports. Next. Then the way forward is last 5 years, we have not sanctioned any new projects. Now, this year, our proposal has been approved by the EFC, and very soon, cabinet proposal is under process. We will be sanctioning new watershed projects from current year onwards. Then there is a utilization of the 2,000 crore budget which we got from the budget, and DOLR, WDCPM case 2, we intend to contribute significantly for the land degradation neutrality targets and sustainable development goals, doubling of farmer incomes. Next. And this new generation watershed is also included this spring shed development. Earlier, spring shed development was not a very priority area in watershed, but now new generation projects, spring shed is included. In all Himalayan states, we will be focusing on spring shed development also. And next, this is what I want to show. Unless until community is taken care of their activities, I think our role will be very limited. We are only facilitators. So Gram Panchayats and Gram Sabhas are expected to play this role, and they should motivate the community to take care of all those activities. And thank you very much.
So one quick feedback or clarification. If anybody has question or any some feedback to submit, है कोई? अच्छा,
सर बहुत ही आपका अच्छा प्रेजेंटेशन रहा रेडी सर, बहुत बहुत धन्यवाद प्रेजेंटेशन के लिए। सर मेरा इसमें एक ही क्वेरी है वाटरशेड की जो भी स्कीम्स देखे हैं उनमें सर, जैसा कि आपने इसमें एक कोटेशन भी दिया अभी कि गांव का पानी गांव में, खेत का पानी खेत में, तो मैं केवल ये जानना चाह रहा हूँ कि कुछ इस प्रकार की स्टडीज़ हुई हैं कि इस प्रकार की स्कीम जो कर रहे हैं हम लोग पानी को रोक रहे हैं उससे कहीं कोई नेचुरल जो फ्लो ऑफ वाटर है उसके कारण से कहीं जो इश्यूज़ या प्रॉब्लम्स अगर कहीं क्रिएट होते हैं या हुए हैं, या इसके ऊपर कोई स्टडीज़ हुई हैं उसके बारे में अगर आप थोड़ा कुछ जानकारी दे सकें।
नहीं, अभी तक हमारे नोटिस में तो नहीं आया है ऐसा कोई वाटर हार्वेस्टिंग की वजह से कुछ प्रॉब्लम हुआ है करके। देयर इज नो सच इश्यू, मोस्टली बिकॉज we take up the project areas in a very dry and rain-fed and degraded areas, and the possibility of such issue may not arise, even if arises somewhere, and so far ministry knowledge में तो नहीं है, we haven't received any such notices।
नहीं, मेरा सिर्फ ये क्वेरी था सर, इसमें हम नेचुरल फ्लो को एक ढंग से रोक रहे हैं, जैसा कि कई बड़े बड़े जो बांध पहले बनाने का जो कंसेप्ट था।
एक्चुअली लेट मी क्लैरिफाई कि हम लोग थोड़ा जीपीडीपी फोकस हमारा है, तो इसमें बहुत ज़्यादा टेक्निकल रिसर्च के हम उस पर फोकस नहीं हमारा, तो इसको आप अलग से उनसे बात कर लीजिएगा।
थैंक यू,
ठीक है ना। तो थैंक्स अ लॉट रेड्डी साहब योर प्रेजेंटेशन, एंड आई रिक्वेस्ट टू ऑल पार्टिसिपेंट्स कि इसको भी आप ध्यान में रखें। दिस इज वेरी नेचुरल रिसोर्स मैनेजमेंट, और जो आपके सेक्रेटरी साहब जो बता रहे थे इकोलॉजी एनवायरनमेंट का, तो दिस शुड फाइंड प्लानिंग का जब हम रीजनल जब कॉन्फ्रेंस में जाएंगे देन आई थिंक वी शुड बी मोर फोकस्ड। Today just 15 minutes, we are not able to give
clarification, sir. Since panchayats are very well aware of this program, sir, there is no problem in bringing this item into your GPDP, sir. So we may use it this.
Okay. So next I will invite from Ministry of Health and Family Welfare, Sri Atul Kotwal sahab. Please make your presentation, and उनके जो, because you know health, education, sanitation, drinking water, nutrition, they are really very critical for the people, and so again 15 minutes we are not doing justice, but whatever we can do here.
Thank you, Chairperson sir. Good afternoon everyone. I had prepared for 20-25 odd minutes as looking at the program, but I'll try to wind up as early as possible. Just a quick overview, and health, as you all know, is all-encompassing. Very difficult to do justice even in short time, but then I'll try to, because you all have been working at ground level and you're aware of all the health programs which are available. So I'll be covering more of National Health Mission, but also, of course, other programs also which the ministry is running. So this slide doesn't need any explanation. Health is determined by the individual, the environment, the social determinants, and even the health systems and the availability of the health care. This is the present delivery structure. If you see, slight changes here where we have, that's why I'm showing this from 2018 onwards. is a community health officer which has come at SHC, HWC level, sub-health center, health and wellness center. 2018 आप सबको पता होगा आयुष्मान भारत स्कीम हुई, इसके दो पार्ट हैं, हेल्थ एंड वेलनेस सेंटर कंपोनेंट और पीएमजे कंपोनेंट. सो ये हेल्थ एंड वेलनेस सेंटर कंपोनेंट जो है ये नेशनल हेल्थ मिशन का पार्ट है. तो इसमें सब सेंटर्स एंड पीएचसी दे हैव बीन कन्वर्टेड नाउ टू health and wellness centers, all, and target is 1,50,000 till December next year. SHC and PCs to be converted to health and wellness centers, and we are on route to our target. Till date, we have converted more than 77,000 health and wellness centers in the country, with more than 54,000 CHOs already in place. CHO is one of the game changers because सब health center पे आपको सबको पता होगा सिर्फ ANM या MPWs थे. तो अब यहाँ पे एक CHO level का function ही आ गया, which is supposed to provide leadership role to the entire health team over there. And of course, you all are aware, CHC and block level community center, accredited private facilities, and further up the secondary and higher specialist services and tertiary care. This is what the new this thing also looks like. With the health and wellness centers component now, the packages have increased. From 7 packages now, 5 packages now. Earlier there were 5, now there are 12 packages which the services are available. They are being rolled out gradually, but most of the places it is the beginning has been made. These were the existing services focusing more on the RM and CHA, reproductive, maternal, neonatal, child health, and nutrition and adolescent. Now we have gone beyond. We are looking at a lot of other communicable diseases, treatment of mental and neurological disorders, i.e. ENT, oral health, non-communicable disease screening, and even elderly and palliative care. So all these are being added, and of course, continuum of care is another important issue, which all the Gram Panchayats should also know, that the health functionaries are being trained how to refer the case up and then to follow it up till the individual comes back to the village, and they are followed up for the medicines and also for their condition. This is what I was just alluding to. These are the new ones: mental health, burns and trauma, elderly and palliative health care, basic oral care, ophthalmic and eye and ENT problems, screening and management of non-communicable diseases. These were there earlier, and the major focus was on RM and CHA and plus minor illnesses. This I'll skip because this is not a part this year. But our request from Ministry of Health and Family Welfare side is that focus of the Gram Panchayat should be, on the SDG goals and National Health Policy 2017. As the JS from MOP are also informed me in the morning about the SDG. So that kindly look at the SDG 3 and all the indicators therein. The conversion of sub-health centers and PHCs to the sub-health center rather for the Gram Panchayat, sub-health centers to health and wellness centers, achieving 90% routine immunization, and also tuberculosis. That's another one of the major focus areas. So key roles will be planning at village level, village health sanitation nutrition committee platform, which takes stock of situation regularly along with Asha. Asha is member secretary of this committee. Addressing inequities. I think Secretary Panchayati Raj also mentioned in the morning. Awareness generation and community mobilization with IEC, BCC. It takes time, it takes a lot of effort for awareness generation and community mobilization. That's why even after so many years we are behind, but then one has to make more effort, concerted effort. And now with the more facilities available at the health and wellness centers, at the sub-center level, with the HWCs coming up, you'll find it easier to mobilize the community and exhort them to use more of public health services. Support for intersectoral convergence, ICDS, education, drinking water, sanitation. I don't think I need to repeat any of this. Leverage funds from all other sources. I'll touch upon these. 15th Finance Commission, after a delay of more than 25 years from the 73rd Amendment, now funds have been given directly to the Panchayati Raj institution and urban local bodies for health sector, which are quite a lot in amount. Action on indoor-outdoor air pollution. It is linked with a lot of diseases, and Ujjwala scheme and all you all are aware of. So in planning process, you have to understand the milestones and indicators. Situation analysis gaps. This also becomes important now for the 15th Finance Commission. Situation analysis and identification of gaps. The guidelines have been issued recently. Checklists are already there. Estimation of resources required, prioritization, mapping, and of course monitoring mechanisms. We are creating a dashboard at the ministry, at the national level, where ECRP2, if any of you are aware of that, have been working in that, we are monitoring from there, including the GIS mapping and photographs of each and every asset. So similarly, it will be expanded gradually for the entire NHM, including the PMASBY, which is about to be announced shortly, and for the 15th Finance Commission grants. So you leverage technology for data capturing, and we'll also be able to give you more information to that. Here are the various resources. I think you all are aware of what all to be looked at and how they can be converged for the betterment of the village. So the services level planning imperatives, drugs and diagnostics at all levels. The expanded list of drugs and diagnostics are available. Registration of birth, marriage and death 100%, also all the antenatal cases. Institutional deliveries, including cesarean section and the FRUs activation. Immunization, all the neonatal care units, SNCUs, NICU and NBCC. Home-based neonatal care and home-based young child care. The RBSK, what Joint Secretary Education also mentioned with the schools. So we have RBSK teams going to school every year to look at 4 Ds. I'll discuss in detail about this. And family planning and nutrition rehabilitation centers, another important aspect. So communicable diseases, I'll just skip this slide. I'll come to it later on. NCDs, PMJ, again enrollment of, this is important, sorry. Enrollment of beneficiaries, empanelment of hospitals claiming funds. And for the DBT schemes like Janani Suraksha Yojana, which has made a tremendous impact on increasing the institutional delivery. 2005 में NRHM हम लोग लॉन्च किया था, मैं प्लानिंग कमीशन में था, तो हम लोगों ने JSY यही सोच के की थी कि इससे ही institutional delivery increase होगी. And we've improved right somehow in that. And 15 years later, we have a large number of institutional deliveries taking place in the government facilities. And also Nikshay Poshan Yojana for the tuberculosis, money for the monthly diet. Cross-cutting, which are across all sectors for planning imperatives. Buildings, including maintenance and renovation, equipment, human resources. So you all should be aware what should be the vacancies at, of course, at village level, the CHO and two ANMs, one male, one female, or both females. So you should be able to, approach the districts for the needs as per requirement and vacancy based. हम इसको 2012 का IPHS रिवाइज हो रहा है 21 में, but of course at the health and wellness center it is same. Availability of medicine, essential drug list. DBDMS software just see that all the facilities are using for maintaining their drugs and vaccines. And district drugstore logistic arrangements, of course. Diagnostics again at all level. There's a biomedical equipment management and maintenance program. The engineers are available. So in case anything is not functioning in your HWCs at any level, you are aware that the engineers are available and they should be there as per the minimum downtime of any kind of equipment. Training and blood services and referral transport 108, 102. I think आप सभी को इसको बारे में विदित होगा इसका. Just few 4-5 slides on 15 Finance Commission. 70,000 odd crores over next 5 years, out of which 3,928 crores for the healthcare facility in the rural areas. So इसमें one is block public health unit. This is a unique concept now because public health unit जो है block में will look after all functions, public health as well as clinical as well as HMIS. इन तीनों combine करेगा. And PMASBY जो भी announce होगा उसमें district level पे we are having district integrated public health lab. So all this will be integrated in the entire integrated public health information system. So that is going to be announced shortly. So support for diagnostic at the primary healthcare facilities, building like sub-centers and also conversion of rural PHCs and subset sub-centers into health and wellness centers. So building less के लिए आपको कैसे करना है, construction के लिए पैसा मिलेगा. You should be aware 55 lakh for SHC, which is maximum, 1.43 for PHC and 5.75 for SCHC. So इसका gap assessment, as I mentioned earlier, we recently on 31st August we issued the entire guidance notes, which is a thick book, but chapter 1 gives the entire overview and summary, and we have made checklists how every state, district, block and Gram Panchayat and all, they will use the checklist and see where are the gaps, and we have given the indicative list of prioritization also, that which ones to be prioritized, rented को देना है या building less को देना है, dilapidated को देना है. So as per that and depending on your requirement, you have to select sites, but of course building less में the money, they are all 15 finance commission, they are all tight funds, but building less के लिए पैसा तभी release होगा अगर आपका land availability already है. So for that we are making the monitoring dashboard where we will get the photograph of land with GIS mapping from you. Conversion of rural PHC subcenter into health and wellness centers with of course all the additional services. This is very important, performance-based incentives for CHOs and team-based incentives for HWC team and also ASHA incentives. We have built in all the incentives in the National Health Mission framework and also in the 15th Finance Commission. 9.7 lakh conversion of each subcenter and 5.6 lakh per conversion each PHC into health and wellness center. JAS का मैं आपको भी बाद में फिर बताऊंगा. This is where the Gram Panchayat also plays a very important role as far as the health services are concerned. Diagnostic again, SSC, PHC depend again gap analysis. Earlier we had only 8 or 9 tests at SSC and about 14-15 tests at PHC. So we test ka number, if you see, has been increased tremendously. 14 at sub-center and 63 at, these are the health and wellness centers. So this is the amount you get, maximum 3.91 lakh for each SHC and maximum 25 lakh for each PHC. So there are a lot of money in the diagnostic infrastructure. And urban में भी यही किया गया है. Those of you who would like to know, the diagnostics money is there for the urban PHC and for the conversion of and for creation of urban health and wellness centers. 15,000 की population के ऊपर slums or other areas के लिए. These next few slides I'll skip quickly and come to the format which can be used at every village level for the Gram Panchayat level. This I have mentioned earlier, but just to put it in the context. So this is leading to transformation. There's a capacity building of the team which is taking place. Universal screening and management NCDs have started. Community health worker, जैसे मैंने पहले बताया था, to provide a leadership role at the community level. And incremental expansion of packages, which is already national level training has been done for all, state level training has been done for a lot of packages, and that further training of everything, all other are being there, is being conducted. This is the platforms which are available to us and to you to support health, to ensure that people get good quality, affordable and equitable health as per the principles of universal health coverage. So you can help us in planning, implementation, monitoring as well as evidence-based decision making. So you have VHSNC, which you all are aware. It's 10,000 untied fund also which is available. Asha is a functionary. I have not written the name deliberately here. She is not a regular employee, but she is the main fulcrum on which the entire HWC functions. But Asha is the link between the sub-center HWC and the VHSNC. And Jan Arogya Samiti, instead of Rogi Kalyan Samitis which were there, we said, let's say Jan Arogya Samiti. We want the concept moving more towards wellness. Because all these HWCs will always have a place for wellness activities, yoga and all other activities. Northeast states, we have allowed them to do Zumba. So as per the state requirement or state initiative. So institutional platform is there, and JAS ka chairman, as you know, these slides I think we could be shared with you also. I'm not reading. Untied funds 50,000 and 1.75 for PHC. These are also available for the Gram Panchayat. And Vishwas initiative you all know, to synergize health, water, sanitation and all. And इसमें ODF की morning में बात हुई थी. So the very good thing, स्वच्छ स्वस्थ सर्वत्र SSS आप सबने सुना होगा. Their money is now being given to CHCs and all for reaching the quality improvement level. And sub-center में I will just like to mention here, quality improvement is another division in NHSRC, and we are issuing certificates under Lakshya as well as Kayakalp as well as the NQuas certification. And now we have made guidelines for that also. And I think 17 probably will be releasing those operational guidelines for all. And Rogi Kalyan Samiti is at the higher level. So up to PHC level, we don't have Rogi Kalyan, we have wellness concept. And CHC and above, we have Rogi Kalyan Samiti. Again, funding is there available, untied fund for CHC and district hospital also. Okay. So just quickly, Janani Suraksha, Shishu Suraksha Karyakram. This is where the, when after JSY, after a few years, we all realized that no, we must look at the mother-child diet in totality. So there we included the diagnostic diet, and even, it's 3 days or 7 days depending, admission, normal delivery or cesarean. So all that kind of admission and diet and all, and also the referral transport. Janani Suraksha Yojana, you all are aware, ये तो पुरानी है. So funds are available to the beneficiary as well as to ASHA, depending whether normal delivery or cesarean and rural or urban which area. And Pradhan Mantri Surakshit Matritva Abhiyan, this is launched a few years ago. This is 9th of every month. There's a dedicated day where, so to increase the proportion of women who get fully registered for antenatal care, and to make sure that all of them have 4 minimum antenatal checkups during their pregnancy. Family planning, you all are aware of this. There's spacing methods, limiting methods, all these are being made available. Home-based care for newborn and young child. There are two this thing to reduce the neonatal mortality for newborn care. That is 6 visits, 3, 7, 14, 21, 28, and 42 days, and 7 in case of a home delivery. And young child up to, so you see, we want to go beyond in infancy. So there are 4 visits, 3rd, 6th, 9th, and 12th month. And immunization, again, I think you all are aware now. We have also added there are more than 12 vaccines. 11 are in almost all states. 1 is still under pilot phase. The pneumococcal also has been added now. And in Mission Indradhanush, aap sabko pata hoga, various rounds have taken place, and a lot of uptake has increased because of courtesy Mission Indradhanush. And in this, I think in all these health, whatever we are achieving, the role of Gram Panchayats is really commendable everywhere. Diarrhea management, I think it's an old thing we all are aware. By now, enough IEC and BCC has been done. National Deworming Day is done. NRCs are functioning very well. Anyone in any village and all, in case of malnutrition, and you should be aware that NRC is there and transport is also available. Sir, 2 minutes. Universal screening, this is what I was mentioning, RBSK, where we have integrated Ayush. The team leaders of RBSK are Ayush. It has combination of 3 minimum. Screening of newborns, these are 4 Ds, defects at birth, deficiency, diseases, and learning and developmental delays, including disabilities. So इसमें 30 diseases पूरी हैं इसमें, and district level पे early intervention centers खुले हैं. So in your villages and all gram panchayats and all must know to identify early and should be aware that these teams are available. Rashtriya Kishore Swasthya Karyakram, again to look at the all the adolescents. Communicable diseases, tuberculosis, you all are aware, a lot of information would have come to you by now. AIDS and viral hepatitis. Viral hepatitis is a new one to go to end hepatitis by 2030. For hepatitis C, antivirals are now available, which were earlier for I think $3,000+ and all. Now it is available for just about 200 or 300 rupees only. So all that medicines for hepatitis C are also available in under this program. Anemia book Bharat, you all are aware. Okay, I'll quickly come to the screening. I think I must mention that hypertension, heart disease, diabetes, oral cancer, breast cancer, cervical cancer. This screening has been started, trainings are being given, and a lot of screening has been done. We get numbers in crores all India level, and disaggregated data is also available with us, where people have been screened for hypertension, diabetes, and even oral cancer, cervical cancer, and CA breast. Spectral bone and leprosy. Okay. This PMJ, just a quick word on this. The secondary tertiary treatment, 5 lakh per family. And details, I think further details you would be knowing. But we want is that our system, all our CHCs and district hospitals become paneled in the PMJ program, so that people can be referred there for secondary treatment at least. And how can GPs enhance utilization of PMJ? Encourage community members who are comfortable to use IT system to enroll as Ayushman Mitra. So they can do that. Coordinate community platforms to generate awareness and mobilize and support eligible community members for enrolling in this. There's one Jan Aushadhi Kendra. Here also AMS ki each district should have one Aushadhi Kendra to provide generic medicines of high quality at very low cost as compared to the branded ones, and the combinations which are being used by the multinational firms instead of that. So once these districts are saturated, the aim is to bring them down up to the block or even block level. 1 minute on this. Instead of audit, somehow we have now started moving towards accountability, because what we feel is that yes, you can do audit of Manrega or all the other things. Health is very a lot of things are unmeasurable. You can't measure everything about health. As far as infrastructure, HR, diagnostics, drugs, everything is concerned, they are physical things which we can be measured. But as far as the feelings, perceived effect or satisfaction, dissatisfaction are concerned, we need social accountability. We've created this framework. I'll share the slide with you, but very soon we are going to issue the guidelines. Sir, 1 minute more. This is the template. How at village level, every ASHA along with VHSNC should every year, now when your exercise is starting next month, once you see that overview has to be there, after overview the progress on each and all these programs which I have discussed just now. For all these at village level, this kind of template which is made, it will help you in planning in the entire GPDP as well as the higher levels also. This same slide can be used at the block or district level also.
Excellent.
Thank you.
So Kotal sir, so before I will invite one, I will request my GPDP जो टेक्निकल टीम बैठे हैं यहाँ पे, श्लोक, प्रियंका और जो भी हैं, तो आज ये नाउ व्हाट आई एम फीलिंग कि हर एक मिनिस्ट्री का जो प्रेजेंटेशन हो रहा है, जो फ्लैगशिप प्रोग्राम्स हैं करीब 15-20 हैं, तो हम केवल मेमोरी पे छोड़ देंगे पंचायत को, अगर जीपीडीपी में करें वैसे नहीं होगा. तो आप लोग ये जो फॉर्मेट है उस जीपीडीपी के फॉर्मेट में अब इंक्लूड कर दें. हर एक जो इनके जो 5-6 प्रोग्राम है, इनके जो 3-4 प्रोग्राम है, मैडम के 3-4 हैं, हर एक के जितने फ्लैगशिप प्रोग्राम्स है बाई नेम, सो दैट वो जीपीडीपी में डिफॉल्ट हो उनको करना पड़े वो प्रोग्रामिंग, नहीं तो नहीं हो पाएगा. हाँ, फॉर्मेट में बिल्डअप कर दीजिए उसको. हाँ, एंड वो जीपीडीपी के फॉर्मेट में इनबिल्ट करना पड़ेगा। नहीं आप इनबिल्ट करेंगे तो केवल हम रिसोर्स पर्सन को बोलेंगे आप ट्रेनिंग करके करा दो, वो अब पॉसिबल नहीं है। काहे कि ये बाय ऑन मेमोरी वी कांट प्रिपेयर और जीपीडीपी। देयर आर अराउंड 15 to 20 सच फ्लैगशिप प्रोग्राम्स जो हम लोग आज 5-6
बढ़िया निकले हैं सर।
एंड इसको आप तो जीपीडीपी टेक्निकल टीम आप जरा बैठिए और उसको जीपीडीपी के उसमें इनबिल्ट करवाइए आप इसको, है ना। सो भंजाऊ आप भी इसमें बैठिए, कात्रिसन जी बैठिए, हमारे टेक्निकल टीम बैठ के लेट इट टेक 7 days टाइम बट इट हैज टू बी इनबिल्ट।
Sir, I would like to thank Mr. Kotwal for a very nice presentation. There were a couple of things, however, I will not let go of this opportunity. One is that the participation of health frontline workers is pretty low. I mean, considering they have such an important role, especially in COVID times, we would require, like if 95,000 odd panchayats, the frontline workers are from health department are participating, then there is a serious gap. And given the importance which we now acknowledge even more through your presentation, it becomes important that they are sensitized. They must participate in the GPTP exercise as frontline workers. Dusra, I wanted to ask about the telemedicine. Is it coming through? Because when we talk about convergences, we have schools, we have Gram Panchayat Bhavans, we have PHCs, where the expertise of doctors and others, now telemedicine is acceptable form. Yes. Is it coming through? And obviously you putting in a lot of schemes with a lot of money which is coming in, which we want to be included in our program so that people are aware that they can, जो resource envelope की बात हम लोग कर रहे थे कि अगर ये provision है तो we will, justice will might leverage it. ये वाला part हम लोग करेंगे. But आपका maximum जैसे sanitation and drinking water से आपका relation जो है health से बहुत ज़्यादा है. So उसकी convergences पे भी I think we should work on that. So that is something I just wanted to share with you.
Thank you, ma'am. Just quick, with the permission of chair. Ma'am, I'll first come to this thing, teleconsultation. As per March 2020 guidelines, teleconsultation is legal. उससे पहले illegal नहीं था. पर उसके कुछ पूरे तरीके हैं how consultation is done and how the prescription has to be given. E-Sanjeevani is now being strengthened very well. In fact, I would request all of you to try sometime. Just log in from your respective state, usi language ka, and if you can share your experience also, how much waiting time is there, because our e-health division ministry is doing a tremendous job by upgrading e-Sanjeevani every day. The target is to have more than 5 lakh consultations per day, and we have reached almost 1 lakh, almost 70 to 80,000. इसके लिए there are a lot of specific ECRP2, which was announced in July, and funding has already been given more than 50%. उसमें teleconsultation के लिए और e-ICU के लिए पैसे दिए गए हैं. The centers of excellence at the district level and with a hub and spoke model, money is being given to below district level for spokes to create the teleconsultation. That is number one. A lot of funds are available. Please find out from your state district health societies. Then secondly, जो even ASHA workers हैं, उनको we are giving them all smartphones and ANMs and CHOs for teleconsultation. The patient को वहाँ बिठा के they can do consultation directly with the PHCMO. Or when ASHA workers are in field, they can connect directly to the CHO or to PHCMO as per requirement. So we are working on this, ma'am. But point noted, we'll issue some specific more information on this. Sir, I think during lunch, I think we can.
Any feedback from audience, from participants? Just one, because we have no time. So we are way behind the schedule.
Jana Ausati Kendra in rural areas, how SHGs can be included? How the SHGs can be provided that Jana Ausati Kendra? Is there any support from the government for starting this? Training is required, that can be explained, sir.
This is a Ministry of Chemicals and Fertilizers. The Ministry of Health directly doesn't deal with it. But good point. We'll ensure that the detailed guidelines are given. They already issued earlier last year. The present health minister did tremendous amount of work in this area last year. So we'll again convey that the guidelines are issued again.
Quickly, please.
Namaskar, sir. Sir, I'm from UP. As you rightly said, sir, GPDP में जब तक की health और sanitation का, what we noticed that in the GPDP framework, you have included the support, the financial envelope, then the sectors including water, sanitation, hygiene, health, education, all are there, but not the SDG goal number 1, end poverty, and This one, the second one is
इसको कराएंगे,
Rohangar.
इसको हम लोग
That is not there.
करा देंगे.
Second thing is, sir, the mission into the gaps which are identified in mission into the survey that are not being used much in GPDP. So my suggestion, my submission is, if it could be preluded in this GPDP framework itself, that these are the critical gaps found in the of the village, particular village, and this should be included.
हाँ आप बोलिए.
One, sir,
नहीं please.
last point is, sir.
बैठ जाइए, टाइम नहीं बिल्कुल हमारे पास. वो लेडी वहाँ पे, बिकॉज वो बहुत देर से. आप अपना ईमेल करके और जैसे लंच मिल लीजिए, काहे कि ऑलरेडी अब 2 बजने जा रहे हैं, है ना. वो 1 घंटे पीछे चल रहे हैं हम लोग शेड्यूल से.
गुड आफ्टरनून सर, दिस इज नीलम फ्रॉम हरियाणा, प्लानिंग एक्सपर्ट. सर मेरा 2 ही सजेशन है कि एक रिसेंटली अभी मैंने अपने हरियाणा स्टेट में खासकर जीपीडीपी को लेके कुछ एक्सपेरिमेंट शुरू किए. तो जो हमारा एक मनरेगा का लेबर बजट बनाया जाता है और उसकी ग्राम सभा होती है सर 2 अक्टूबर को, तो वो ग्राम सभा क्यों ना हम जीपीडीपी की ग्राम सभा के साथ एक तो मर्ज करें. और दूसरा ये कि जो एमए डेटा का जो खैर इस ईयर तो सर्वे होगा नहीं, लेकिन नेक्स्ट ईयर जब सर्वे होगा बहुत सारे ऐसे डेटा के अंदर जो है मतलब इनवेरिएशन है कि जो डिपार्टमेंट जिस डिपार्टमेंट का डेटा है क्यों ना वो ही उस डेटा को वेरीफाई करे, क्योंकि जो विलेज रिसोर्स पर्सन ने गांव वाइज जो डेटा आइडेंटिफाई किया उसमें कहीं ना कहीं बहुत सारे गैप्स हैं. तो अगर कंसर्न डिपार्टमेंट उसको करेगा तो दैट विल बी
क्वाइट ए गुड सजेशन एंड वी विल वर्क ऑन दिस. तो अभी इमीडिएटली आई कांट गिव कमेंट, वी विल वर्क ऑन दिस. सो लेट मी इनवाइट द फाइनल स्पीकर, अभी जो हमारे मिनिस्ट्री ऑफ एमएसएमई के हैं श्री चंद्रशेखर जी, तो डायरेक्टर हैं. सो आई इनवाइट हिम एंड प्लीज मेक अ प्रेजेंटेशन.
Good afternoon. Respected Dr. Chandrasekhar Kumar, Additional Secretary, Ministry of Panchayat Raj, and Chairman of today's program. Distinguished speakers from the various line ministries, senior officers from the ministry, delegates and participants. I am really delighted and happy to participate in today's People's Plan campaign 2021 organized in NIRD today. From the Ministry of MSME, we have identified 4 important schemes which can be implemented in convergence mode with the Panchayat Raj institutions. PMEGP, Spurti, Aspire and National SCST Hub. These are the 4 schemes we have identified. Prime Minister Employment Generation Program. The main objective of this program is to create employment opportunities in both urban and rural areas. The maximum admissible cost for manufacturing sector under PMEGP is 25 lakhs. For service sector, the admissible cost is 10 lakhs. There is a subsidy element in this. For general category candidates, 15% subsidy is allowed in urban areas and 25% in rural areas. Similarly, for special category, SC, ST, OBC and minorities, 25% subsidy is given in urban areas and 35% subsidy in rural areas. Promoter contribution is required from the entrepreneurs. For general category, it is 10% and for special category, it is 5%. Successfully grounded PMEGP units having good performance, if they want to go for additional loan, they can go for it. Maximum loan is given 1 crore with a subsidy cap of 15%. 20% is given for northeastern region and hilly areas. Performance of the PMEGP scheme. Total enterprise created as on 20th July 2021 is 7 lakh. 7 lakh enterprise have been grounded. Total estimated employment generated since 2008 and 9 is 57 lakhs. Average subsidy for each employment generated is 30,000. Total subsidy dispersed as of now is 16,800 crores. Estimated bank rate is 43,700 crores. PMEGP is a very good scheme. It's a flagship scheme of the ministry, implemented throughout India in all the states. Earlier, aspiring entrepreneurs need to submit application offline at KVIC and KVIB and DICs. Now the offline system has been dispensed with. A separate portal has been created for PMEGP online or KVC online. These two portals can be utilized for filing an application. For filing an online application. Application is very simple. It's one-page format. And the implementing agency at the national level is KVIC, Khadi Village Industries Commission. At the state level, there are three agencies, KVIB, DIC, as well as the KVIC Directorate, State Directorate. Convergence opportunities with the PRAs. PRAs can basically, they can identify the beneficiaries and assist them in filing the online application. And they can organize awareness programs, motivational programs, so that the aspiring entrepreneurs gets motivated and submit online application. They can also provide marketing support and other support from the state governments, and hand-holding mentoring support can be given to the beneficiaries. Scheme of fund for generation of traditional industries. This is called Spurti. This is a cluster scheme. Our ministry is implementing two cluster schemes. Micro Small Enterprises Cluster Development Program. This is a big. This scheme is mainly meant for big industry, big clusters actually, and Spurti is mainly meant for traditional industries and as well as the artisans. There are two components within the Spurti. Artisans up to 500 are considered as a mini cluster. 2.5 crore subsidy is given to mini clusters, and 5 crores is given to major clusters. Over and above, having artisans over and above 500. Common facility centers can be established with the grantee and support from the Government of India for procurement of machinery, raw material bank, construction of common facility center, training and skill development, design and product development, and market linkages. Performance of Spurti scheme. Total 434 clusters have been uploaded on all-India basis as of now, and 145 clusters have already been grounded. 2.5 lakh employment is provided to 2.5 lakh people, and the Spurti assistance provided till date is 1106 crores, and 831 crores has been released as of today. Convergence opportunities for PRAs and Spurti. PRA can be implementing agency. There can be many implementing agencies, government agencies, as well as even the NGOs also can come forward and can be implementing agency, provided they have some expertise in the cluster development. Implementing agency can provide land and building to the project, and they can implement various interventions approved under the DPR. And management and maintenance of the CFC can be taken up by the PRI. This is the Aspire scheme. Again, there are two elements within this Aspire scheme: livelihood business incubator and technology business incubator. The main purpose of livelihood business incubator is skill development training and entrepreneurship. For government institutions and technical institutions, a grant of 1 crore will be given for procurement of plant and machinery. And for private institutions and NGOs, matching contribution of 50 lakhs is given. The NGO has to, private agency has to bring in the 50% of contribution, and 50% will be given by Government of India in the form of grant in aid for procurement of plant and machinery. So these facilities basically can be utilized for imparting training and skill development, as well as promoting entrepreneurship. Performance of Aspire scheme. As on today, total 102 LBS have been approved throughout India, and 50,000 people have been trained, and 8,136 persons have been employed, and 14,261 people have already started their enterprises. This actually Aspire scheme is a very good scheme for rural areas, because it can give training, and after getting training, the persons can get the job, and if he is interested, he can go for self-employment. Convergence for Aspire is identification of requirement of sector-specific technical training. So PRS can identify sector-specific areas for training, identifying block and district level technical institutions which can be set up, LBS. All the ITAs and polytechnics can submit an application for LBI. Even the engineering colleges, even private engineering colleges also, because 50% grant in aid is given to private institutions, And government institutions, government ITS and polytechnics, total grant is available is 1 crore. And land and building is not covered in this project. The grant in aid should be utilized only for plant and machinery. PRS can identify the students for training in existing LBS and LBS, supporting trained students and incubators by connecting them to various government schemes. National SC/ST Hub. Basically, National SC/ST Hub is meant for promoting entrepreneurship among the SC/STs and Dalits. Under SC/ST Hub, 25% capital subsidy is given for Dalits and SC/STs who want to set up MSMEs. Maximum subsidy is 25 lakhs. Similarly, reimbursement of membership fee for export promotion. If a SC/ST entrepreneur takes a membership in the Export Promotion Council, 50% of that fees will be reimbursed, subject to ceiling of 1 lakh. And bank loan processing fee is reimbursed up to 50%, subject to ceiling of 1 lakh. And bank charges for performance bank guarantee, 50%, that is equivalent, subject to ceiling of 1 lakh. And reimbursement fee for short-term courses of top NIR rated management institutions, 90%, subject to ceiling of 1 lakh. These are the financial assistance facilities available to SC/STs and women entrepreneurs, SC/STs under National SC/ST Hub. Performance of SC/ST Hub, trained SC/ST entrepreneurs till date is 27,000. Dedicated nodal officers appointed till date is 135. Candidates benefited through subsidy schemes till date is 21,000. New entrepreneurs set up till date is 437. Total procurement from SC/ST MSCs during. Actually, another objective of SC/ST Hub is to achieve the 4% target mandated under the public procurement policy. Government of India has notified a public procurement policy in the year 2012. Basically, 25% target is given to all the ministries and central government CPSUs and departments for procurement of 25% of the outsourced requirements only for micro and small enterprises. Out of 25%, 4% target is allocated to SC/ST entrepreneurs. And SC/ST is having mandate to achieve that 4% target. Convergence opportunities for PRS, identification of relevant SC/ST MSCs operating in the blocks and districts, awareness creation about the SC/ST Hub, facilitation participation in the special marketing action scheme, providing training to SC/ST beneficiaries, identification of successful SC/ST entrepreneurs at the taluk and block and district level. These are the 4 important schemes available from Ministry of MSME. Actually, there should be a small element of entrepreneurship in the development plan of the panchayat, from panchayat level onwards, panchayat level, block level and district level. The slogan of one enterprise in one panchayat should be promoted extensively, and 100 MSMEs in one block and 1,000 MSMEs in one district. This should be target. Actually, this target should be incorporated in the development plan. The target looks to be exaggerating, but even if you achieve 20% of the target, it's still a great going, and definitely rural economy will improve, and regional disparities will be reduced, and migration from the rural areas and from rural areas to urban areas will be arrested. So I request the Panchayat of the department to include these 4 schemes in the development plans of the DPDP, BPDP, and district development plans. Thank you so much.
Thank you, Chandrasekhar ji. So before lunch, one question we can, or one feedback we can invite, just one. So and then we will lined up for the lunch. So anybody has any important or significant question to me? Okay, if not, then what I will request all the participants, you can always send us email your feedback, your suggestions, your ideas, and when you send us, you also send to the ministry, also as to NIRDPR, because it is joint, so that we can incorporate your ideas in the GPDP framework. And also I request to our very esteemed guests and speakers, if they also want us to incorporate something very important, so they can send us 1 or 2 pages of these, that this must be included in GPDP or this must be discussed in Gram Sabha. So a summary of, if so I will request our very esteemed speakers. So if so that will help us also, and that will help us in drawing attention. So I think I must thank all the speakers. They have done really good work. They prepared a very beautiful presentation, very informative, and now it is up to us. Now it is really up to us how we can carry it forward. So let us make very good use of this, whatever effort has been made today, and I hope, I have full confidence on all of us that will carry it forward. And any doubt, any future, please don't shy in contacting us. We will be working on this. Thank you very much.
Thank you, sir. May I request our chairman, sir, to present a memento to our dignitaries from line ministries.
Hello, hello, hello. Mic test one.
Hyderabad folder supaya camera connected.
I welcome you all for the post-lunch session of National Level Orientation Workshop on People's Plan Campaign 2021, Sabki Yojana, Sabka Vikas. Since national lockdown was announced in March 2020 to contain the spread of COVID-19 pandemic, panchayats have been striving hard to their best in providing relief as well as in supplementing preventive measures in rural areas. With the onset of People's Plan Campaign 2021, may I request the state of Maharashtra, Kerala, Himachal Pradesh, and Chhattisgarh to share their PPC 2020 experiences. May I request Shri Sunil Kumar, Secretary, Ministry of Panchayati Raj, to chair the session.
I am already here. Start.
Over to you, sir.
Let them make the presentation.
Yes. Yes.
Good afternoon to all. Honorable Secretary Sir, respected dignitaries from the MOPR, representatives from the different states, my teammates from the Maharashtra state and friends. I am here to give the short presentation on PPC. Last year, how we have implemented, what are the difficulties we sought during the implementation of the PPC, as well as what the solutions we have arrived at. This presentation of the PPC 2020 is limited to the points given to us by the NIRD, sir. This is the information regarding PRIs working in the Maharashtra. The number of Gram Panchayat in Maharashtra are around 28,000 and its population ranges from the 500 to 80,000. So this is the variation in the population and size of the GPs in the Maharashtra. Most of the GPs in tribal area, hilly area and in remote areas are having a very small population, and for those Gram Panchayats it becomes rather difficult to implement some of the stages of the PPC, like having the board in time, or the number of meetings and the ward meetings, women meeting, to take the separate meetings. These are the some issues to be tackled by these small Gram Panchayats. Sir, during the last year, we have we had appointed all the state, district and block nodal officers. Similarly, during this year also we have appointed state level and district level nodal officers. Block level officers appointment of and uploading those names is under progress. During the last week only we have got some general transfer orders, and within 8 days they will resume their duties, and we are going to upload all the nodal officers. Facilitators for every Gram Panchayat were appointed last year. There was a training programs in our state, sir. Each and every district has got the 4 master trainers we have trained from our SRD. And then these 4 master trainers and 2 officers from each district, they conduct the different types of the training at district and block level, sir. Our training unit for the GPDP is the cluster unit, which is the Panchayat Samiti or block Panchayat constituency, which includes on an average 7 to 8 GPs in a constituency, that is the cluster. And cluster level workshops are conducted at the cluster places in that cluster. These there are also for each and every cluster we have appointed 2 officers. One is the extension officer who is working in that block, and one is the supervisor, ICDS supervisor, to get the involvement of the SHGs and women in that village for the Gram Sabha. We are appointed these 2 persons for the each and every cluster, so that and they are also given the training, rigorous training for 3 days training as a master trainers training. And these 2 officers give the training at cluster level to the all the panchayat members, then elected members and village level functioning groups, as well as there is a 1-day training program for these SHG members, SHG chairman, and then CRPs and Anganwadi Sevika, and all these 2 training programs are conducted at each cluster regarding GPDP. During this year, last year, due to pandemic situation, we have approved all the plans in our Gram Panchayat monthly meetings, and they will be ratified after in the next Gram Sabha, sir. In all GPs, sir, we are conducting Mahila Sabha, Bal Sabha, and meetings of the deprived classes of the society. And that is we are doing that for last 2 years, and all these meetings are conducted by the 2 persons which are appointed for that cluster. That is the extension officer and the supervisor, ICD supervisor. They organize these meetings and they handhold these meetings for involvement of these Mahila and these deprived classes of the society. All these meetings are conducted by observing the pandemic protocol applicable in the state. Almost all the activities in the PPG during last year were completed, like nomination of frontline workers, MA data validation, PIB, facilitators, feedback reports, etc. Almost all the activities we have completed. All GPs have uploaded their 21-22 plan on e-Gram Swaraj. Sir, the constraints we have faced during last year, due to pandemic situation, the training programs we could not able to complete within time. As well as, sir, the classes we have conducted, the participants number was just 20 to 25 instead of 40, 50. So number of classes we have increased and we have completed those training programs, sir. Gram Sabhas were not conducted and plans were approved by the GP meetings. There was a very less response from the line departments. The reason given by them was there is no manpower, sufficient manpower to attend the Gram Sabha, each and every Gram Sabha. Actually, these line departments have manpower structure in some departments they have only district level officials. Some departments have block level offices. But at village level, most of the departments do not have their functionaries working in the particular village. So that was the problem they have given to us. So to resolve this problem, we have given one format to each and all the HODs in the district. There is a one-day workshop for the district HODs as well as Jilla Parishad HODs and line department HODs, in which the format is circulated to them and ask them to submit village-wise information to the concerned village. With that format includes what are their programs, what are their criteria, how to select the works under that program. Then second part of that report is to what are the activities they are conducting during the current year in that village. And the third part is which program they are going to conduct or implement in that village during the next year. On these 3 points, these reports are they are supposed to submit to the concerned Gram Panchayat through block development officers, and in the Gram Sabha, the Gram Panchayat secretary will read it down to the Gram Sabha, and it will be known to all the villages in that Gram Panchayat. So because the line departments do not have the manpower, so this is the solution we are going to implement, and this year it will be followed accordingly. Instructions has been already issued, sir. Then, sir, during this year, sir, one problem actually I thought that there is a MA survey during this year also. But last 2 years, sir, in our state there is some issues regarding payment to the facilitators. That issue has been already referred to the ministry, sir. Some suggestions, sir, online training cost norms should be circulated, sir, because most of the programs now we are conducting online. Then flexibility in the RGSA sanction plan, sir, at least in the training activities, in order to cover the unexpected training needs arise. So, sir, during this year we are facing DP and block and district plans, and under that those guidelines we have to have additional committees at the district and block, and their training program is to be covered under RGSA. That activity is not included in the plan, sir, but that is to be necessary to cover. So within the training component, it is that flexibility should be allowed to the state, sir. Then last point is to PPC advertisement campaign at the national level, so that people at large will come to know what are the activities under PPC, sir. These are some of the photos then, sir, regarding training programs conducted during last year, and some of them are conducted during this year, sir. Due to pandemic situation.
Okay, thank you.
Thank you, sir.
Okay, thank you. Next, हिमाचल आपका है. रेखा जी, ना कोई लिस्ट है ना कुछ है, क्या ये है?
Good afternoon, the dignitaries and senior officers from MOPR, organizers and officers from NIRD, all the esteemed delegates, my teammates from Himachal. I have been invited to deliver the deliberations on the status of GPDP and the challenges faced during the implementation of GPDP in the state of Himachal Pradesh. So the state of Himachal Pradesh is a tiny hill state having 12 districts, 81 blocks, 3,615 GPs, and almost 20,000 villages. Average size of Gram Panchayat in terms of population is 2,000 people per Panchayat. So I would like to share that Himachal is one of the pioneer states in the nation which started formulation and implementation of micro plan as early as 90s, in the late decade of 1990s. But due to paucity of untied clear-cut funds, this experiment could not be succeeded. And for the years together, the ice could not be broken. Then, in the middle of last decade, 14th Finance Commission came out with bold suggestions and transferred around 2 lakh crore clear-cut funds to the Gram Panchayats at their disposal completely. इससे क्या हुआ कि पंचायतों में जो अनटाइड पैसे की समस्या थी वो लगभग समाप्त हो गई और अब पंचायतों को क्लियर कट ये निर्देश दे दिया गया कि आर्टिकल 243 जी के तहत, जो कि इसके पीछे की एक गाइडिंग स्पिरिट है, गाइडिंग प्रिंसिपल है, आर्टिकल 243 के तहत इकोनॉमिक डेवलपमेंट और सोशल जस्टिस की प्लानिंग खुद करें, खुद इसकी योजना बनाएं, क्योंकि वास्तविकताएं उनको पता है, नीड उनको पता है, दे नो द सॉल्यूशंस बेटर देन एनीबॉडी. एंड सर, प्लस पॉइंट ये अच्छी बात यह है कि नाउ GPDP हैज टेकन डीप रूट्स, इट हैज इम्बाइब्ड इनटू द सिस्टम as far as state of Himachal Pradesh is concerned. Participation and convergence are the two main key concepts which are associated with GPDP. Now, we have at state level, we have noticed a paradigm shift. ढांचागत विकास से हटकर अब बात की जाती है और ये चीज़ पंचायतों को निर्देश दे दिए गए हैं कि GPDP में जो कॉस्टलेस डेवलपमेंट का कंपोनेंट है, जो कॉस्टलेस एक्टिविटीज़ है, उसमें पैराडाइम शिफ्ट की बात करें, उसमें सोशल डेवलपमेंट की बात करें, उसमें ह्यूमन डेवलपमेंट की बात करें.
आगे चलिए.
Yes, sir. This is the status of nodal officers. We have been appointing duly appointing the nodal officer at the state level for the department as well as for the different line departments. All 15 line departments covering 29 subjects duly notified their state nodal officers for their respective departments. Next. Similarly, district nodal officers for various line departments were also appointed and notified. Facilitators for every Gram Panchayat was appointed in the state of Himachal Pradesh. Panchayat secretaries are best suited for this task. Therefore, as such, they were appointed as facilitators, and in future also they will be appointed as facilitators. Means of community mobilization to ensure participation of community, circulation of agenda through following modes was ensured. WhatsApp groups down the line up to ward members as well as panchayat secretaries was created, and in this regard, state NIC, the state came to the help of department and created a SMS gateway. So we have ensured wide publicity through electronic media, through आकाशवाणी. एक मैं छोटी सी क्लिप सब आपको मैं सुनाना चाहूँगा, अगर थोड़ा सा समय दें.
कैसे करवाओगे? ग्राम सभा में जब नहीं होगी आपकी भागीदारी, तब असफल होगी पंचायतों की योजना सारी. गांव में सुविधा को है बढ़ाना, जन जन की किस्मत को है चमकाना. घर घर में सुविधा पहुंचाएं, सभी के सपने साकार बनाएं. आओ सब मिलके ये कसम खाओ, पंचायत के सर्वांगीण विकास के लिए मिलजुल के योजना बनाओ. हमारा एक ही सपना, सुंदर स्वच्छ विकसित गाँव हो अपना. जी हाँ, अगर आपने विभिन्न योजनाओं जैसे ग्राम पंचायत विकास योजना, मोक्ष धाम, स्वच्छ भारत मिशन, मनरेगा, मातृशक्ति बीमा योजना का लाभ उठाना है तो ग्राम सभा की बैठक में जाकर अपना योगदान जरूर दें. पंचायती राज विभाग हिमाचल प्रदेश द्वारा जनहित में जारी. ग्राम सभा अगर नहीं
सर, ये छोटी सी क्लिप है लेकिन इसका परकोलेटिंग इफेक्ट है डाउन द लाइन. सर, these are the glimpses of Gram Sabha in PES area, sir. This is the most difficult area to govern. Next. Through various letters and video conferences, wide publicity was also ensured through print media as well as electronic media. Slogans were aired through आकाशवाणी, जैसा सर मैंने अभी बताया आपको. Next. All Gram Panchayats duly constituted and notified their Gram Panchayat planning facilitation teams with Panchayat Pradhan as the chairperson of this committee and Panchayat Secretary as the member secretary. The member of this team were given training at the block level as well as the cluster level. In accordance with the provisions of Section 5B and 7A of the HP Panchayati Raj Act 1994, Mahila Sabha and Ward Sabha have been constituted in every Gram Panchayat of the state. The meeting of the Ward Sabha precedes the meeting of the actual Gram Sabha. The issue pertaining to the concerned ward are discussed before taking them further to the Gram Sabha. The Mahila Gram Sabhas hold two meetings, first on 8th March and second on the first Sunday of September in each year, which are convened by the Mahila Pradhan or in her absence by the Mahila Up Pradhan and in the absence of both by the senior Mahila member of the Gram Panchayat. Issues related with children वो भी इसी में डिस्कस किए जाते हैं, अलग से बाल सभा जो है वो कंडक्ट नहीं की जाती है. फ्रंटलाइन वर्कर्स का स्टेटस देखें सर आप, इट वाज एंश्योर्ड दैट ऑल 15 लाइन डिपार्टमेंट्स ड्यूली अपॉइंट their frontline workers to attend the Gram Sabha during PPC. The said frontline workers attended the Gram Sabhas and gave a structured presentation pertaining to the department. The development status report, that is situational analysis, was presented in the Gram Sabha, and before that critical gap study was conducted. Final GPDP was presented before the Gram Sabha for its consideration and then approval. The plans which were approved by the Gram Sabha after consideration of EGS portal were uploaded. All GPs have put up PIBs, public information boards, and uploaded their images on the GPDB portal. Line departments remained reluctant. These are certain constraints. Line departments remained reluctant to share their resources. जैसा सुबह GS मैम ने भी इसका जिक्र किया था. Insufficiency of staff at Gram Panchayat level compounded the difficulty in preparation process, lack of connectivity in travel and pest areas and remote areas. इसके अलावा सर कुछ और बड़े issues हैं which I would like to highlight through this forum. इसी पहले issue को highlight करूँगा मैं सर, the minuscule sharing of resources by land departments. Though this is a symbiotic relationship, Panchayati Raj institutions, they will get strengthened, and the line departments, they will also be benefited through this relationship, through symbiotic relationship, but they are still reluctant to share their resources. GPDP is an intersectoral exercise. This is not confined only to the Panchayati Raj department. ये सबकी योजना है, ये सबका विकास है. से इसमें सर एक और बहुत बड़ा इशू है कि फ्रंट लाइन वर्कर जो भी ग्राम सभा की मीटिंग अटेंड करते हैं, दे आर नॉट वेल कन्वर्सेंट विद द पॉलिसीज एंड इनिशिएटिव्स टू देयर रिस्पेक्टिव डिपार्टमेंट्स. उनको अपने ही डिपार्टमेंट की सर नॉलेज नहीं होती है, इसलिए वो ग्राम सभा में कुछ भी बताने में असमर्थ होते हैं. टेक्निकल इश्यूज कुछ एक सर मैं हाईलाइट करूँगा. एक तो पहले बताया जा चुका है कि हमारे जो हिमाचल में रिमोट पॉकेट्स है उसमें कनेक्टिविटी का इशू आज भी है सर. इसके अलावा सर जब प्लान फाइनल हो जाता है, जब तैयार हो जाता है, उसको अपलोड करने के लिए EGS पे, ई ग्राम सभा पोर्टल पे वो बड़ी जल्दी सेशन आउट शो कर देता है. इसका वे आउट ये है कि सिलेक्ट ऑल की ऑप्शन यदि उसमें आती है तो एक ही क्लिक में सबको सिलेक्ट करके जो है वो प्लान को अप्रूव किया जा सकता है. लास्ट कंस्ट्रेंट विच आई वुड लाइक टू हाईलाइट, इट इज़ ये हमेशा कहा गया कि सर पंचायतें जो हैं वो सेल्फ हेल्प ग्रुप के साथ मिलकर काम करेंगी, उससे पंचायतों में कोरम की समस्या भी खत्म हो जाएगी और सेल्फ हेल्प ग्रुप्स भी उससे बेनिफिटेड होंगे. लेकिन मोस्ट ऑफ द टाइम्स सेल्फ हेल्प ग्रुप जो हैं उनकी पार्टिसिपेशन बहुत लो रहती है इन द मीटिंग्स ऑफ ग्राम सभा. विद दीज वर्ड्स आई वाइंड अप माई प्रेजेंटेशन. थैंक यू MOPR, थैंक यू NIRDPR.
थैंक यू. यहाँ पर now I'll request Chhattisgarh to make their presentation, and please focus on whether any, say, the issue which has been highlighted is that the frontline workers, they are not adequately prepared or knowledgeable or in a position to present details about their schemes. So whether any effort has been made by the district level officers to provide to their frontline workers or to the panchayat secretary a standard sort of presentation or standard material which can be shared with the Gram Sabha in the meetings of the Gram Sabha, because that is one area. Second, whether the gap analysis and others which were mentioned by the AS in the morning session, whether any effort has been made to undertake that Mission Antyodaya gap analysis and present it in the meetings of the Gram Sabha. इस पर अगर कुछ किए हैं तो बाकी चीज़ों के अलावा इस पर भी बताइए.
सीजी फाइनल पीपी. आप सबको छत्तीसगढ़ की ओर से हार्दिक अभिनंदन एवं स्वागत करता हूं मैं, और NIRDPR MOPR को मुझे इस डायस पे बुलाने के लिए हार्दिक धन्यवाद ज्ञापन करता हूं. और मैं छत्तीसगढ़ शासन की ओर से आज अनुभवों को साझा करने हेतु मुझे जो आमंत्रित किया गया है, वो मैं छत्तीसगढ़ की ओर से जो PPC 2020 में हमने बनाया था पब्लिक प्लान कैंपेन, उसके बारे में मैं आपको अपने अनुभवों को साझा करता हूँ. नेक्स्ट PPT. छत्तीसगढ़ में कुल 28 डिस्ट्रिक्ट्स हैं, जिसमें 146 ब्लॉक्स हैं, और 146 ब्लॉक्स में से 85 ब्लॉक्स जो हैं वो पेशा ब्लॉक्स हैं हमारे, और 11,664 हमारी जो है वो GPs हैं ग्राम पंचायत. इसमें से 5,555 जो है वो GPs जो है हमारी वो पेशा ब्लॉक्स हैं. लगभग 50% जो है वो हमारे पेशा ब्लॉक्स पेशा GPs हैं. टोटल GPs जिला पंचायत के जो सदस्य हैं हमारे 402 हैं, और जनपद जो सदस्य हैं 2,979 हैं, और ग्राम पंचायत के जो सदस्यों की संख्या है 1,72,000 के आसपास है. और हमारा जो नेक्स्ट इलेक्शन जो था वो जनवरी-फरवरी 2020 में हुआ है, और हम जो GPDP जो तैयार कर रहे हैं उसमें सभी SDGs गोल्स पे हम बात कर रहे हैं. नेक्स्ट हमारा जो, जैसा कि सवेरे एस सर ने कहा था कि विज़न होना चाहिए, तो हमारे स्टेट ने भी विज़न फिक्स किया हुआ है कि हमारा जो GPDP है और DPDP और BPDP जो है, इसका विज़न हमने फिक्स किया है कि समाज का सबसे जो कमज़ोर वर्ग का जो व्यक्ति है, जो अंतिम पंक्ति पर बैठा है, जो हाशिए पे बैठा हुआ व्यक्ति है, उसको इस योजना का लाभ मिलना चाहिए. नेक्स्ट. हमने जो ग्राम पंचायत विकास योजना की जो हमारी जो तैयारी थी 2021 की, वो पूरे 142 बिंदुओं पर आधारित मिशन अंत्योदय सर्वे से जो प्राप्त गैप थे, उन गैप्स को हमने प्रथम जो हमारी ग्राम सभा की जो मीटिंग्स हुई थी उसमें हमने ये गैप्स को जो है चिन्हित करके वहाँ पे वाचन किया. उसके बाद कोविड-19 के कारण हमने ग्राम सभा के स्थान पे वार्ड सभा, महिला सभा और बाल सभा का आयोजन किया. सभाओं में अगर कोई व्यक्ति अनुपस्थित रहता है, ग्राम सभा का अगर कोई सदस्य नहीं आता है किसी कारणवश, तो उसके लिए हमने एक प्रपत्र का निर्माण किया, और वो प्रपत्र जो है प्रत्येक ग्राम सभा के सदस्यों को वितरित किया, जो लोग ये इन सभाओं में अनुपस्थित थे उनके लिए. और वो प्रपत्र भर करके जो है वो ग्राम पंचायत के सचिव के पास उसको वो जमा किया, और वो प्रपत्र को जो है ग्राम पंचायत की मीटिंग में पढ़ करके सुनाया गया, और उसके पश्चात जो है वो कार्य योजना को अंतिम रूप दिया गया. गूगल मीट के माध्यम से हमने जहां जहां गूगल मीट के माध्यम से संभव था वहां पे वर्चुअल ग्राम सभा का भी हमने आयोजन किया. मॉडल GPDP हेतु प्रति जिला 2 ग्राम पंचायतों का मॉडल GPDP बनाने के लिए भी हमारे स्टेट के द्वारा पहल किया गया, और मॉडल GPDP कैसा होगा इसके लिए भी एक प्रपत्र का निर्माण हमारे द्वारा किया गया. राज्य, जिला और जनपद स्तर पर नोडल अधिकारियों का भी इस पे हमने चयन किया, और प्रत्येक ग्राम पंचायत द्वारा पहली जो ग्राम सभा होगी उसमें संकल्प का निर्धारण किया गया कि हमारी ग्राम पंचायत विकास योजना कैसी होगी. जो हमने विजन था, हमारा जो विजन था कि समाज का जो सबसे कमजोर वर्ग का व्यक्ति है, जो हाशिए पे बैठा हुआ व्यक्ति है, जहां तक लोगों की पहुंच सुनिश्चित नहीं हो पाती है, उनको इस योजना का लाभ हमको कैसे उपलब्ध कराना, ये हमने संकल्प वहां पे लिया. और प्रत्येक ग्राम पंचायत द्वारा BPRP निर्माण भी तय सीमा में इसको पूरा कर हमने किया, और लाउड स्पीकर के माध्यम से ग्राम सभा का लाइव प्रसारण किया कि ग्राम सभा में जो भी प्रस्ताव पारित होंगे उसको लाउड स्पीकर के माध्यम से भी हमने उसको प्रसारित करवाया. ये शासन के द्वारा जो है टाइमलाइन जो है वो जारी किया गया था. गवर्नमेंट ऑर्डर नंबर है 156 3/9/2020 को ये ऑर्डर जारी किया गया, जिसमें ये समस्त गतिविधियों को हमने ऑर्डर के माध्यम से जो कलेक्टर्स हैं हमारे डिस्ट्रिक्ट कलेक्टर्स और मुख्य कार्यपालन अधिकारी जिला पंचायत, उनको हमने ये वितरित किया ताकि ये हमारे जीपीडीपी निर्माण में ये सारी चीज़ें इंक्लूड की जा सके। नेक्स्ट, ये हमारा जो 2 पेज का प्रपत्र था, जो कि ग्राम सभा में जो सदस्य उपस्थित नहीं हो पा रहे थे उनको हमने डोर टू डोर ये वितरित कराया था, और ये भर करके जब वो जमा कर दिए तो ग्राम पंचायत की मीटिंग्स में इसको पढ़ करके सुनाया गया कि जो सदस्य उपस्थित नहीं थे उनकी ये मांग है, इसको हमको जीपीडीपी में इनकॉर्पोरेट करना है। नेक्स्ट, जनपद और जिला विकास योजना की तैयारी हमने इस प्रकार से की थी। नेक्स्ट, जनपद स्तर पे हमने 2 समिति बनाई, निगरानी समिति जिसमें जनपद अध्यक्ष की अध्यक्षता में निगरानी समिति थी, और योजना निर्माण समिति जो है हमारे अनुविभागीय अधिकारी राजस्व के माध्यम से ये योजना निर्माण समिति बनाई गई। जिला स्तर पे भी हमने 2 समिति बनाई, निगरानी समिति जिसमें जिला पंचायत की अध्यक्षता में जो है ये निगरानी समिति काम करेगी, और योजना निर्माण समिति जो है वो जिला कलेक्टर की अध्यक्षता में, और जो भी जो जनपद विकास योजना है और वो जो जिला पंचायत विकास योजना है इसका अनुमोदन जो है सामान्य सभा में करने का हमने ये प्रस्ताव बनाया जो है। और प्रत्येक वर्ष हमने 4 विषयों को प्राथमिकता वर्किंग ग्रुप का गठन कर किया गया कि 4 विषय जो है, जैसे शिक्षा, जैसे अभी बात हुई थी कि अगर इस वर्ष हमने शिक्षा लिया, स्वास्थ्य लिया, महिला बाल विकास से संबंधित मुद्दों को लिया, तो नेक्स्ट वर्ष वो चेंज हो जाएगा ताकि हमारे सारे गोल्स को हम कवर कर सकें। नेक्स्ट, ये बीपीडीपी और जीपीडीपी निर्माण के लिए जो एमओपीआर के माध्यम से हमें जो टाइमलाइन मिला था, इस टाइमलाइन को हमने तयशुदा समय में पूरा करने का प्रयास किया। नेक्स्ट, ये ज्वाइंट सेक्रेटरी श्री केसी सेठी साहब जो है वो मास्टर टेनिस का जो प्रशिक्षण था उसका इनॉग्रेशन वर्चुअल माध्यम से किया केसी सेठी साहब ने, और हमारे जो है 3 डेज का जो है वो जिला स्तर के मास्टर टेनिस को हमने ट्रेनिंग दिया। हमारे यहाँ 21 डिस्ट्रिक्ट्स में जो है डीपीआरसी है और 6 डिस्ट्रिक्ट में ईटीसी और पीटीसी है, तो यहाँ पे भी हमने जो है 3 दिन का जो है जिला स्तर के मास्टर टेनिस के माध्यम से यहाँ पे ट्रेनिंग जो है वो ऑर्गेनाइज करवाया, और जीपी लेवल पे 1 डेज का ट्रेनिंग यहाँ पे हमने करवाया। नेक्स्ट, राज्य शासन के द्वारा जो है हमारे यहाँ जो है अभिनव पहल किया गया, कोविड-19 को ध्यान में रखते हुए उत्कृष्ट जीपीडीपी तैयार करने वाली 50 ग्राम पंचायतों को पुरस्कृत करने की योजना जो है वो शासन ने शुरू किया। उत्कृष्ट बीपीडीपी 146 जनपद पंचायत है हमारे यहाँ, उसमें से 5 जनपद पंचायत जो उत्कृष्ट जीपीडीपी बनाएगी उसको भी पुरस्कृत करने की योजना बनाई गई, और उत्कृष्ट डीपीडीपी जो हमारे यहाँ 28 जिले हैं, उस 28 जिले में से 3 जिला पंचायत को जो है उत्कृष्ट डीपी बनाने के लिए भी पुरस्कृत करने का प्रावधान किया गया, और इसका मूल्यांकन और चयन का जो दायित्व है ग्राम पंचायत का जो चयन है वो जनपद पंचायत स्तर पे किया जाएगा, और जो जनपद का जो चयन है वो संभाग कमिश्नर के द्वारा किया जाएगा, और जिले का जो चयन है वो स्टेट के द्वारा करने का हमने प्रावधान रखा जो है। नेक्स्ट, ये शासन का ऑर्डर था उत्कृष्ट ग्राम पंचायतों को पुरस्कार देने के लिए। 50 ग्राम पंचायत का जो चयन होगा उसको प्रति ग्राम पंचायत 10,000 रुपए का पुरस्कार दिया जाएगा। 5 जनपद पंचायत जो थी उनको 25,000 रुपए प्रति जनपद पंचायत पुरस्कार दिया जाएगा, और 3 जिला पंचायत जो है वो प्रति जनपद जिला पंचायत 50,000, इस प्रकार 7,75,000 रुपए का जो है वो पुरस्कार की घोषणा जो है वो शासन के द्वारा की गई। और ये जो चयन होगा उत्कृष्ट ग्राम पंचायत को, उसके चयन का भी हमने स्केल निर्धारित किया कि महिला और स्व सहायता समूह के द्वारा अगर गरीबी उन्मूलन के प्लान को ऑनलाइन किया जाता है तो उसको 1 नंबर उसमें मिलेगा। न्यूनतम 5 सहयोगी विभाग लाइन डिपार्टमेंट के 5 विभागों का अगर प्रेजेंटेशन किया जाता है और उसको ऑनलाइन किया जाता है तो 1 नंबर, इस प्रकार ये 10 नंबर उनको देने का प्रावधान किया गया, और ये सारी चीजें ऑनलाइन उसमें रखी गई। नेक्स्ट, ये डिटेल्स आईसी एक्टिविटीज है। हमने माननीय मुख्यमंत्री महोदय और माननीय मंत्री जी का जो है वो न्यूज़पेपर में जो है अपील प्रसारित करवाया 30/9/2020 को। जीपीडीपी गाइडलाइन का इनॉग्रेशन करवाया 15/9/2020 को। हैंड होल्डिंग सपोर्ट्स हमने उनको दिया 15/9/2020 को। ये कार्यक्रम हमारा काफ़ी सफल हुआ। जैसे हिमाचल के अभी हमारे एक साथी ने दिखाया कि हमारे ग्राम सभा ये हमारे यहाँ एवरी संडे को जो है 7 बजे से 7:30 बजे के बीच रविवार को प्रसारित किया जाता है रेडियो धारावाहिक कार्यक्रम। और इसमें सारे लाइन डिपार्टमेंट्स को जो है उनकी योजनाएं क्या होंगी, उन बेनिफिशरीज का चयन कैसे होगा और जीपीडीपी में हम उसको कैसे इनकॉर्पोरेट कर सकते हैं, ये बताने का उसमें प्रयास किया जाता है। ये कार्यक्रम हमारा काफ़ी सक्सेसफुल हुआ। ये हमने पहला एपिसोड इसको 2 अक्टूबर 2020 को दिखाया और फिर नेक्स्ट जो दूसरी हमारी जो ग्राम सभा होगी 30/12/2020 को, उसमें भी हमने इसको पुनः प्रसारित कराया। साथ ही में पोस्टर, मैगजीन्स और वॉल राइटिंग भी हमने इसमें प्रावधान किया। नेक्स्ट, ये माननीय सीएम साहब जो हैं वो जीपीडीपी मॉड्यूल्स और जनप्रतिनिधियों के लिए आधारभूत प्रशिक्षण जीपीडीपी हेतु जो है वो इनॉग्रेशन कर रहे हैं। माननीय मुख्यमंत्री जी हैं, माननीय मंत्री जी पंचायत एवं ग्रामीण विकास विभाग, माननीय सचिव महोदय और संचालक SIRD और ACS CM। नेक्स्ट, ये माननीय मुख्यमंत्री जी के द्वारा जो है समस्त प्रदेश की समस्त जनप्रतिनिधियों को संबोधित किया जा रहा है 2 अक्टूबर 2020 को। नेक्स्ट, ये विभिन्न प्रकार के IC एक्टिविटीज हैं जो न्यूज़पेपर में प्रकाशित हुए। नव भारत में है कि अपने दायित्व को, जैसे सवेरे बात हो रही थी कन्वर्जेंस की बात, तो वही हमारे CM भी कर रहे हैं कि कैसे अपने दायित्व को हम बेहतर करें। नेक्स्ट, ये हाइपर लिंक करना 2 मिनट का वीडियो, हमारे माननीय मंत्री जी हैं TS सिंहदेव जी, ये कन्वर्जेंस को लेकर के अपील कर रहे हैं। हाइपर,
नमस्कार,
थोड़ा साउंड बढ़ाना।
जैसा आप जानते हैं 15वें वित्त आयोग ने 2021-22 के लिए अनुशंसा अपनी दे दी है और राज्य में भी तीनों स्तर की पंचायतों में, पंचायत, जनपद पंचायत और जिला पंचायत, ये तीनों स्तरों पे वंचितों, महिलाओं और बच्चों के सुनियोजित विकास के लिए हमको कार्यक्रम बनाने हैं। 2 अक्टूबर से हमार गांव हमारी योजना हमने शुरू कर दी है। 31 जनवरी तक जन आंदोलन के रूप में हम इसको चलाएंगे। और ये भी आपकी जानकारी में है कि वित्त आयोग के अनुदान के साथ केंद्र और राज्य सरकार की अन्य राशियां जो मिलती हैं उनको अभिसरण के माध्यम से, कन्वर्जेंस के माध्यम से हमको इस्तेमाल करना है और ऐसी योजना आपको तैयार करनी है। कोरोना की महामारी ने हमको ये भी दर्शाया, ये भी हमको दिखाया कि और भी नई परिस्थितियों में नए खर्चे आ जाते हैं, नई जिम्मेदारियां आ जाती हैं। तो जो भी आप योजना बनाएंगे उसमें इस बात का जरूर ध्यान रखेंगे, ऐसा मेरा आप सभी से अनुरोध है। और योजना सभाओं को कोविड की महामारी के मानदंडों का पालन करते हुए कैसे आयोजित करना है, इस बाबत भी पंचायती राज विभाग ने अपनी मार्गदर्शिका गाइडलाइन जारी कर दी है। कोविड के समय सबसे ज्यादा अगर कोई प्रभावित हुए हैं तो हमारे बच्चे और हमारी महिलाएं। तो जब भी आप GPDP, ग्राम पंचायत डेवलपमेंट प्लान, आप इसको बनाएंगे तो इस बात का ध्यान जरूर रखेंगे और सुनिश्चित भी करेंगे कि कम से कम 10% राशि इस वर्ग के लिए, हमारी महिलाओं के लिए, हमारे बच्चों के लिए इस्तेमाल में आएगी। और यूनिसेफ के माध्यम से ये जो लघु चित्र प्रदर्शित होगा, मुझे पूरा विश्वास है कि आपको अपने गांव की योजना बनाने में, GPDP बनाने में भरपूर सहयोग मिलेगा। और GPDP के माध्यम से ग्राम पंचायत के विकास को हम सुनिश्चित स्वरूप दे सकेंगे। एक जिम्मेदार जनप्रतिनिधि के रूप में जनोन्मुखी कार्य में आप लोग अपना पूरी जिम्मेदारी से योगदान देंगे। एक बेहतर ग्राम पंचायत के विकास की योजना, जिसे हम GPDP भी कहते हैं, उसको बनाएंगे। धन्यवाद। जय हिंद, जय छत्तीसगढ़।
नेक्स्ट स्लाइड। ठीक, ये हमारा GPDP का मॉड्यूल है सर, और ये फैसिलिटेटर मॉड्यूल है हमारा जो है। नेक्स्ट, भारत सरकार द्वारा जो निर्धारित समय सीमा थी सर, इसमें हमने मिशन अंत्योदय सर्वे का कार्य 100% पूरा किया सर। BPRP निर्माण और इसको पोर्टल पर अपलोड करने का कार्य भी हमने तय समय पर पूरा किया सर। GPDP, BPDP और DPDP का निर्माण और अपलोड करने का कार्य भी हमने तय समय पर पूरा किया सर। थैंक यू।
Now I'll request Kerala.
respected Secretary MOPR, respected dignitaries on and off the dais. I would like to express thanks to the organizers to present on behalf of Kerala. We are happy to inform you that this is the 25th year of Kerala's People's Plan campaign, and we are starting a lot of activities connected to this 25th year celebration. So with this presentation, I am trying to reflect some of our experience with this People's Plan campaign. Next slide. Okay, this is a timeline of efforts for democratic decentralization in Kerala. The state formed in 1957, and from that year onwards, many efforts were given for democratic decentralization. And after the 73rd and 74th Amendment, we started a People's Plan campaign on 1996. And some other things were also you may familiar, so I am not going into that. Next slide. This is something about the People's Plan campaign. In Malayalam, it is called as Janagiya Sutranam, People's Planning Program. This is a planning process at a local level that we all know, and it started in the 9th five-year plan, 97 to 2002 period. The one thing I want to emphasize is the allocation, fund allocation, that is 35 to 40% of funds were decided to allocate to local bodies when Kerala announced the People's Plan campaign. So that was one of the important things we should notice. And okay, next slide. Okay, these are some of the salient features connected to the People's Plan campaign. There was a huge number of people participated in the planning process, and it provided the opportunity to prioritize their local issues in planning, and also planning got a local development perspective. And another important thing is the inclusion, social inclusion of marginalized communities and the marginalized sections of the society. Okay, next slide. Previous. And one thing we should notice is that the local governments, they are not alone. So they have very good committee systems, and other functionaries are also there now. Not only the functionaries of Panchayat office, the lot of transferred institutions are there. Many line departments transferred their institutions to local bodies. So their staffs are also becoming a part of the Panchayat local body system. So and supports from the voluntary organizations and the neighborhood groups and Kudumbashree system. That is also very much supports the local body system in Kerala. Okay, next. These are some of the features regarding the democratic decentralization of Kerala that you may know. I think the three-tier system and election commission, state finance commission, district planning committee, ombudsman tribunal, audit system, delimitation commission. And for capacity building, that I think for the People's Plan campaign, the capacity building is very much important, and Kerala Kila is doing very much efforts to capacitate the representatives as well as officials to do the planning process very well, and other supporting systems like Information Kerala Mission and Kudumbashree Mission. Okay, next. These are some of the institutions transferred to Gram Panchayats in Kerala. from Agriculture Department, Animal Husbandry, Fisheries, Rural Development, Social Justice, Scheduled Caste Department, Scheduled Tribe Department, Health, Ayurveda, Homeopathy, and Education. Many institutions and also staffs were transferred to Gram Panchayats, and likewise in the higher tiers for block panchayats and district panchayats, them also the higher level institutions were transferred. Okay, next. These are some of the things we want to highlight. At the initial phases, we focused on basic amenities like housing, drinking water, sanitation, roads, bridges, and infrastructure like that. And after that, we focused on some other areas also. Regarding the housing, we for the last 20 years, 25 years, we provided houses around 20 lakhs. 20 lakhs houses were given to poor families, and only around 4 to 5 lakhs is remaining, and that will be achieved in next 4 or 5 years. That is a process going on. And regarding the social security, local bodies have adopted many efforts for social security to support the differently abled children, elderly women, transgender, palliative care, etc. A lot of projects were taken up for these groups. And regarding the women empowerment, also this opportunity, the decentralization as well as People's Plan campaign provided a lot of opportunity to empower the women in the state. And Kudumbashree mission, that is also providing a lot of supports or opportunities for the women in Kerala. And Women Component Plan, that 10% of the fund will be allocated, that should be given for projects for the development of women. And one another thing is that recently, in 2016, Kerala government initiated Nava Kerala Karma Paddhati, the program for New Kerala. In that program, there were 4 missions. That missions really focused on the SDG goals, and most of the SDG goals covered by all these 4 missions. One mission is Ardram mission, that stands for the development of health sector, and education rejuvenation mission, that's for providing better facilities in schools, and life is for housing, and Hyderabad Kerala mission, it's for agriculture, environment, and sanitation activities. And regarding the health sector, a lot of amenities were prepared, were constructed during this period. And in the COVID period, as well as in that flood period, many facilities were very much helped us to be strong in that pandemic. Okay, next. And in agriculture, BRI has taken up projects to cultivate in fallow lands, and Hyderabad Kerala mission, as I said earlier, that contributed very much in last few years. And animal husbandry and marginalized section, to support the marginalized sections, SC, and fishermen people. For SC, we have special component plan separately for the SC community, and TSP for scheduled tribe people. And regarding the good governance, many efforts were given to provide good facilities in the local body offices, Gram Panchayat offices, and block Panchayat. Every offices were constructed in a way where people can come and easily do their application and other things. In 2019, we initiated the programs to establish the front office, and from 2016 onwards, our Panchayat Raj officers were trying to become ISO certified, and we succeeded in 2019. Every Gram Panchayat as well as Block Panchayat offices are now ISO 9001-2005 standard achieved in that year, and many online services were given, like application as well as payment of tax, like that. And now we initiated ILGMS, that is a file management system used in the Gram Panchayats. Okay. In disaster management case, that I said earlier, now the Panchayat Raj institutions are becoming, they played very much role in this pandemic and flood period. This was an opportunity for the Panchayat Raj institutions to show their strength where they are. Okay, next slide. With this slide, I am concluding. This is the next thing we want to focus on. We believe that most of the basic amenities were set up in our state in an extent. So now we are focusing on some second generation issues, and this year we proposed some projects to create employment through skill development, and we have to go some more level in waste management, social inclusion, climate change, and disaster management. And also we need some more efforts to improve people's participation. So this much I'm concluding my presentation. And if anything about related to the last year GPDP or something, we have representatives with me. They will give any clarification if needed. Okay, thank you.
If there are any questions, we can briefly, regarding these presentations, those can be briefly mentioned. Okay. By the way, these presentations were relatively quite straightforward, where they mentioned as to what and how they went about conducting the People's Plan campaign in 2020. Almost all states, they would have done it, something similar, and with regional state-specific variations. But the very fact that 255,000 GPDPs were uploaded shows that every state, they did their bit to ensure that the process or the momentum created by the People's Plan campaign, which culminated in preparation of GPDPs, that was not lost. Now, since we are already running behind schedule, I will quickly share with you my thoughts on what is the way forward. As we have been seeing and stating right from the beginning, that now the concept of GPDP is well understood. It has stabilized. Even at the Gram Panchayat level, through various efforts which have been made by the state authorities, people now know that yes, there is GPDP which needs to be prepared. Now we have to take it to the next level. This poses its own set of challenges. And those challenges you are well acquainted with, you are familiar with. First of all, as we mentioned, even last year we had mentioned that every Gram Panchayat should have a vision or a sankalp, a resolution of what they want to achieve during this current year. The resources at their command are known to them, and there are several goals that can be realized without really requiring a huge resource base. When we say that there are so many such goals which can be addressed with community participation, with support of the people, and which do not require much financial support, that is zero resource based planning, those can also be goals that Panchayat can set for itself and they can achieve. Then the issue of community participation, enhanced participation in the meetings of Gram Sabha, that is very important. Last year, because of the COVID pandemic, we had mentioned, and because in several states, lockdowns and others were in place, we had explained or we had permitted that the GPDPs could be approved in the meetings of Gram Panchayats, and later on when the meetings of Gram Sabha are become possible, then they could be ratified. This year, except a few states where COVID restrictions are in place, where it is not possible to hold large meetings, but smaller congregations are possible. So there, by organizing these meetings of Mahila Sabha, Bal Sabha, Ward Sabhas, it could be possible, or it should be possible, to still ensure wider participation or greater participation of common men in the meetings of Gram Sabha. So that is one challenge that you have. The instructions that we have issued on 16th August regarding making Gram Sabhas vibrant, they apply to Gram Sabhas that will be held for finalization of GPDP. That is in case of those Gram Sabhas, because one question which was raised was that if less than 5% people are only attending the Gram Sabha, how can they be called as representative Gram Sabha? We understand that in several states in the rules provide that if the meeting of Gram Sabha is postponed once and held again, and if even in that second meeting the quorum, so to say, is not fulfilled, then the number of people present in the second meeting which is being conducted after it has been postponed once will be deemed valid enough to ensure that a real valid meeting of Gram Sabha has been held. But what we have suggested in the 16th August guidelines is that at least 10% meeting presence of members should be there, even in case of meetings which have been held after they have been once postponed. So that means this is one area which will be watched. The number of people present in the meetings of Gram Sabha. And in case we find that the GPDPs are being ratified in meetings of Gram Sabha where the presence is less, then that will be for those Gram Panchayats, you may have to take a second call. That may not pass the sort of test that we are setting for ourselves. And in those cases, you may be advised to again hold a meeting of Gram Sabha so that that gets ratified. So this is one important message that all of you must take. Minimum 10% of the members must be present in the meetings of the Gram Sabha. You cannot be having a meeting of 10 people, 15 people and saying that this is the meeting of the Gram Sabha. So that is another important area where all states need to make an effort. I think it was primarily due to COVID restrictions that in states like Kerala, where the presence was less, but I am sure that in 2019, when we were analyzing the data, the presence of members in meetings of Gram Sabha in Kerala was definitely much higher than this 0.2% or 4% that was being shown in the presentation this morning. So this is one important area where every state, and it includes the northern states, Uttar Pradesh, Uttarakhand, Madhya Pradesh, Chhattisgarh, all these states, you have to work to ensure that there is sufficient participation in these meetings of Gram Sabha. If SHG members are not participating, special effort will need to be made. If they can participate as members of Kudumshri in Kerala, in Karnataka in large numbers, so then there is something which is missing in our efforts. So we have to make that effort that at least 1/3 members present in the meetings of Gram Sabha should be women members. So those instructions which have the advisory that has been issued on 16th August 2021, that needs to be carefully studied, focused and acted upon. And NIRDPR, SIRDs, PRCs, all of you, you have to din it in that is a non-negotiable and in case we come across such at a later stage, we can say that all payments in this Gram Panchayat will be stopped till such time as you get it approved in a well-attended meeting of Gram Sabha. The point that was made regarding gap analysis, sectoral expenditure analysis, that is very important. We want all the states to make a beginning. In the morning session, the additional secretary had dwelt on this, and from the ministry as well as NIRDPR and the SIRDs, we would like that suitable advisory may be given as to how this is to be undertaken. Every state, in every state Panchayati Raj Department, Directorate, you have sufficient number of consultants who are working. They have to look at this data which is already there in e-Gram Swaraj portal and make that analysis. It can be done for the state as a whole, for the districts and for the blocks and even Gram Panchayats. So this is something where the data is available on e-Gram Swaraj portal, Mission Antyodaya portal, and the decision support portal which has been prepared under e-Gram Swaraj. So you just have to analyze that. The format of these reports, a standard format could be devised, could be shared with the states so that they can undertake this activity without any delay. Today we are already on 13th September. Maybe in the next 2 to 3 days, this format can be shared and sufficient and appropriate steps taken so that this exercise commences in all the states at the state level to begin with, without any delay. And then that needs to be presented before in the meetings of Gram Sabha. The other important fact is that you know the line ministries, you know the line departments. Get the state level, their schemes all are state level schemes. You don't have district and panchayat specific schemes. So let the concerned directors, commissioners prepare a standard PowerPoint presentation regarding their schemes, 8 to 10 slides in the local language. Let that get circulated to all Gram Panchayat, all Panchayat secretary, all functionaries, so that that will be read out in the meeting of the Gram Sabha. You are not dependent on the quality or the ability of the frontline worker who participates there. If the Chief Minister and the Panchayati Raj Minister can address all elected representatives in one go, so there is no reason why this should not be possible. So not only the instructions should be issued from the state level, giving the various timelines, specific directions should be given to all departmental HODs, director or commissioners to prepare this PowerPoint presentation in 8 to 10 slides, giving details of what the scheme is, what is the resource envelope like, which can be read in the meeting of or presented in the meeting of the Gram Sabha. On SDGs, their localization, some states have done very well. Others have to focus their attention on this. In the revamped RGSA, the focus will be on realization of SDG goals. We are probably having a separate presentation today, but this is one area where we need to work on and we need to focus upon. The focus on service delivery, focus on O&M of operation and maintenance of assets that have already been created, will need to figure in the GPDPs that are being prepared. Everything cannot be just construction of new work. What is already there, their operation and maintenance needs to be focused upon. The easy thing is that a building has been constructed, it needs to be whitewashed, it needs to be painted, it needs to be repaired, and you make that provision. But for certain items, say street lights, pump sets, you need to enter into annual maintenance contracts. So that is something you need not or you cannot wait for the system to break down and then the panchayat goes hunting for an electrician or a linesman or a pump operator to come and rectify that mistake. It is important that for certain services, certain facilities, there should be a routine, regular checkup, there should be an annual maintenance contract. And that is a concept that needs to be built in. Here we have asked the NIRDPR to make a beginning in the field of sort of contract management for water and sanitation services. But then so do street lights. If street lights have been installed, and in several states solar street lights have been installed, they function for 6 months, and then even for some minor repair, there's no one available, there's no maintenance contract, or the contractor who installed the solar street lights, their people are at the state headquarters or district headquarters, none of them is available at the village level. So in those cases, the Gram Panchayat will need to take a lead. And in the days to come, contract management will become an important function for Panchayati Raj functionaries. So this is another area where we'll need to focus upon. And the costs that will need to be paid, those need to be built into the GPDPs. that O&M annual maintenance contract of these services, this will require this much. With greater internet penetration in some panchayats, and I am sure in some forward-looking panchayats, they may be providing free Wi-Fi hotspots. Now, if you are providing that service, annual maintenance will be required. It cannot be that it functions for some time and then it is not there and then it again functions or it is not there. So these are areas where specialized or new areas are or new avenues are opening up. If online classes are becoming the norm, if children in rural areas also have to make use of internet, these are the type of demands that will be made on the panchayat resources, and these are the demands that need to be provided for. Similarly, in several states, public libraries with not only books and magazines, but also internet connectivity. Those are being provided. Those are being provided for in the GPDP, and those are being actually implemented and executed. These are services whose importance cannot be sort of more than what appears. It's absolutely essential if children are to inculcate a reading habit, if they can get access to information without spending too much of their own money or who cannot afford to, these public libraries can be a godsend for them. And these are services which the panchayat needs to provide. So these are areas which need to be included. Similarly, focus on livelihood generation, economic activities, SHGs, VLEPs, all those are well understood. But what we are looking at is that can employment opportunities be provided to local youth, local boys and girls, for providing certain services to the panchayat. What could be these? These are areas that we need to think of. Can a panchayat have a vision of being self-reliant in energy, renewable energy at that? Can it have, or can it sort of envisage or dream that we should one day become self-reliant in energy? And if it has to become one, then how it will go about it? What type of convergence with other schemes of government will be required? What are the various support systems which will need to be put in place? And whether that can create employment opportunities for a group of 10, 15 people in a panchayat or a cluster of gram panchayats. So these are new areas which will need to be looked at. In Himachal, you were showing photographs where through convergence of Manrega and Finance Commission funds, there were gram panchayats which have set up tourism hotels, community centers, and various other. You are also generating employment. And that is an initiative which the panchayat is taking. Similarly, in other parts, in Maharashtra and several other parts, panchayats have taken a lead. They are providing services, and you find local youth, local persons who are gainfully employed in providing those services. So these are areas where we need to focus upon. Zero expenditure activities, yes, those are well understood, well explained. NIRDPR has developed a whole list of such activities which can be undertaken. Those need to be focused upon. Own sources of revenue, asset monetization. When we say asset monetization, it doesn't mean that you have to sell off your land or asset. What it means is that can you look at employing these untied funds, your own source of revenue, for setting up infrastructure or setting up facilities which can generate revenue for the panchayat on a sustainable basis. The demand for, say, a community hall, Bharat Ghar, it's coming from all places. Even in Uttar Pradesh, you find that now there is no public space left where marriage sort of ceremony can be held. The need for that is there. Can the panchayat take the initiative? And there can be various models. Either if the panchayat has so much of its own resources, it can create, maintain it, or create it, lease it out to a sort of service provider, get a sort of rental or whatever from it, and those services get provided to the residents at a reasonable cost. So these assets, how those can be utilized, how those can be put to commercial use by the panchayat to raise revenues, those are also things that need to be discussed and deliberated upon. We were discussing with Director DG NIRDPR, and within next 2 months or so, we'll be organizing a special conference on this own source of revenue, sharing the experience of Gram Panchayats, Block Panchayats and District Panchayats culled from different states with Panchayati Raj functionaries, state functionaries, and also the state finance commissions. So that when the state finance commissions give their report, they reward those Gram Panchayats, those Block Panchayats and District Panchayats, which take initiatives in these matters. So this will be one more area which we'll be focusing upon. Own source of revenue, every Gram Panchayat has to indicate. Even if it is zero, you'll need to say it is zero. But then the next question would be why it is zero. So this is something where all states, and I am aware that there are certain states which do not provide for collection of any fee or taxes by the Gram Panchayats, where everything is free, everything is given by government and that is free. Those states will need to make appropriate changes in their acts and rules. Those powers will need to devolve to the Panchayat PRIs, whether at the Gram Panchayat level or Block Panchayat or District Panchayat level. If quality services are to be provided, the local self-governance institutions will need to be strengthened. They cannot be running to the state government or government of India with a begging bowl all the time. So this is another thing that on which we should be clear. So let's cut it short. The People's Plan Campaign 2021, it will commence on 2nd October. And because COVID is still ongoing till 31st January 22, that is the period which has been stipulated. We know that there will be some lag somewhere. So the month of February and March, in a way, it provides that cushion so that if necessary for certain parts, for certain specific reason, that timeline could be extended. But because beginning 1st April 2022, all expenditure can only be incurred if the GPDPs, block panchayat development plans and district panchayat development plans have been prepared, uploaded, and then only expenditure can be booked. Every Gram Panchayat, every PRI institution will have to onboard PFMS. There is no way out. As was being said in the morning, almost everywhere, it has, except 2 states, Andhra and Telangana, the rest have onboarded. If there's any remaining work to be done, that needs to be completed. The block panchayat development plan and the district panchayat development plan for 22-23, that will also go on during this period. In the morning, it was suggested that first the GPDPs should get prepared, and then based on their analysis, the block panchayat and district development plans could be prepared. So this is something where I don't think our guidelines are very specific and clear on this. If need be, for the preparation of GPDPs from 2nd October to 31st January, and then the month of February and March could be earmarked for preparation of BPDP and district panchayat plan. That will make greater sense, because the GPDP would be feeding into the block panchayat development plan and the district development plan. So this is something where we need to have greater clarity. Last year it was done in an ad hoc manner, but this year it has to be streamlined. And once we do it this year, then from next year onwards, that entire cycle will also become fully clear. And of course, the block panchayat development plan and district panchayat development plan will need to be ratified by the full council. All the elected members of the block panchayat, all the elected members of the district panchayat. So those will need to be thought through, and from the ministry and NIRDPR will say in the next 1 week or so, just think it over. If we need to issue any specific guidelines or recommendations or directions in this regard, those can be given right away so that there is no confusion in the field. And other points which have been mentioned, those you are duly taking care of. How it will be done, you will have to follow the COVID protocol. Those things are well understood. This year we expect better response from the line ministries and line departments. And as we have suggested, and this was also there in the letter of 16th August, that the concerned departments, for the specific agenda which will be discussed in meetings of Gram Sabha, they need to provide not only PowerPoint presentation, if they have a video film, let that be shown in the meeting of Gram Sabha. That people can relate to more easily. Because from what we understand in several states, it's a monologue where the panchayat secretary gets up, stands before the mic with a piece of paper in his hand, and he will keep monotonously reading it off. And no one pays any attention. इसके घर से उसके घर तक 50 मीटर सीसी रोड, इसके घर से उसके घर तक नाली, no one pays any attention. So if we have to make the meetings proper, lively, vibrant, we will need to engage the attention, take steps to catch their attention. And for that, use of these audio-visual short films, that is very handy. And several departments, they already have these 3 minutes, 4 minutes film, 2-minute films ready, which can be shared, widely circulated using various WhatsApp and whatever. So those should be taken, duly taken, made use of. The training program, it will be in a hybrid mode. While you cannot have a stage where everything is done online, but given the experience of last 1.5 years, we all of us realize that despite the technical glitches which sometimes can happen, it is still a cost-effective way of communicating the message, the information that we want to a recipient who otherwise will never be able to attend a meeting in person or a training session in person. So training sessions will be hybrid. The point that was made that the cost norms of such online training may be finalized, fixed, communicated. That is something on which the MOPR is already working on. And I'm sure that with the support of NIRDPR and other experts in the field, which includes those from the state as well, these will be finalized very shortly and communicated to all concerned. In the revamped RGSA that will come into force from beginning next year, the focus on sustainable development goals and training will be huge. But that we will discuss with all of you in various workshops, in various forums as we go along and as the thoughts get or attain a concrete and mature shape in the next few weeks. And I'm sure NIRDPR, which is already working at it, will take the lead in that sphere. So with this, what we expect is that yes, and I have full confidence that with the support of all participants, all states, all Panchayati Raj institutions, the People's Plan campaign commencing on 2nd October 21 will be a huge success. We will be able to achieve the goals that we have set. The data which has been captured through Mission Antyodaya, its analysis and dissemination during this year will be much better than what has happened in the past 3 years. And I'm sure you, all of you, would be agreeing to this, that it was virtually a parallel activity which was ongoing at the same time. It wasn't that Mission Antyodaya survey is being done first and then its inputs are being feeding into the GPDP. So there I support the decision which has been taken by Ministry of Department of Rural Development, that let data analysis take place, let it be placed properly disseminated at all levels, imbibed, action taken before we go in for the next set of Mission Antyodaya survey. And I am sure that based on the feedback that we receive, the periodicity, whether it should be done every 2 years or 3 years, before meaningful data can come out of this exercise, that will begin to clear. And there we'll go by the advice which we receive from the states and the expert bodies like NIRDPR, etc. So these were some of the views that, thoughts that one had. The instructions that we have issued, those are quite comprehensive. For the last 3 years, all of you have already been working on it. And I'm sure at the state level, at the local level, there are several other insights, several other thoughts that you have, which you are free to put into practice. That flexibility is always there. So once again, I wish all of you all the best, and we look forward to having a very successful People's Plan Campaign 2021. Thank you.
Thank you, sir. I would also like to thank the states for presenting their PPC 2020 experience. Now, may I request Dr. Anjan Kumar Bhanja, Associate Professor, NIRDPR, to present his session on evidence-based and data-driven panchayat planning.
So, good afternoon everyone. Respected Secretary MOPR, Joint Secretary MOPR, delegates from states and union territories. I'll be speaking on evidence-based and data-driven panchayat planning. As you know, a quality development plan should reflect and address the most pressing needs of its constituency. In order to identify and address the real issues, a plan should be prepared using necessary and appropriate data. Yes. I have already started, ma'am. 10 minutes, I'll complete. 10 minutes, I'll complete. Okay. Okay. So this is nothing but when you are preparing plan on the basis of appropriate and necessary data, it is known as data-driven or evidence-based plan. Normal situation, in normal practice, we are preparing plan by identifying certain activities and we are uploading those activities on the specified portal, which is considered to be subjectively perceived needs. So instead of highlighting on objectively perceived needs, we are focusing on more on subjectively perceived needs. But that should not be the approach, because by doing that, we are unable to capture and we are unable to identify the real needs which are prevailing on the ground. To make plans evidence-based, we have to prepare, keeping in mind the needs and requirements of needy people. Then accordingly, you can prepare plan. So now let me present before you what data Gram Panchayat, Intermediate Panchayat and District Panchayat need to access to make data-driven and evidence-based plans. It is obvious that to understand, to access these data sources, there should be thorough capacity building and training programs. Without thorough capacity building and training programs, it is very difficult to access data, to collect, to consolidate data and to analyze data. So there are multiple sources of data collections. Okay, so let me highlight few of these sources of data which can be utilized while preparing Gram Panchayat plan, Block Panchayat plan and District Panchayat plan. Yeah. Yes. Yeah. So, if you see, information is nothing but it's a source of power, you can say. When you are preparing any plan, we have to depend upon information. Information is nothing but it is nothing but data. When you are referring to data, it includes information and knowledge. So when you are preparing plan, you have to depend upon this information. We have to depend upon this knowledge. And this appears there is no information gap between real needs and panchayat planning. When you are preparing plan, there is a gap always. We are unable to capture, we are unable to identify the real needs of the people. So to identify the real needs and problems of the people, we have to collect necessary, appropriate, timely data. Okay, so we have to find out different sources of data which can support our planning process adequately. What are those? There are different sources of secondary data collection for while preparing planning. These are different sources. Census data. This is most reliable source of data, as you know. Most of the international and national agencies, they are depending upon this source of data. And if you see, this kind of information you are getting from this source of data, that is demographic information, economic activities, information on economic activity, literacy, education and all, then scheduled caste, scheduled tribes. Okay, so we are getting all this information. So when you are preparing Gram Panchayat development plan and block Panchayat development plan or district Panchayat development plan, so these data can be utilized for situation analysis, and it can be utilized when you are going for gap analysis. So that can be, this source can be utilized for undertaking this kind of activities. So to access the census data, this is the link. One can access the census by using this link. Then socio-economic caste census data. This data, as you know, the census, it was conducted first in 2011. And it is the study of socio-economic status of households, focusing caste-based census of socio-economic situation. This source provides data with regard to education profile, employment and income, disability profile, then profile of highly vulnerable sections of the people, like primitive tribal groups. So this source can be utilized while identifying the different vulnerable groups, and when you are going for undertaking situation analysis, and when you are going for analyzing gaps. And this is the link to access this ACCC data. Then this district census handbook, as you know, it contains both census and non-census data of urban and rural areas. It contains two parts. Part one that deals with village and town directory, block level maps showing village boundary, then analytical note on census findings. Then part B contains important statistics on districts, brief note on primary census abstract, like this. So if you see the varieties of data which you are getting from this source, those include block level maps with village boundaries, village wide educational infrastructure, like how many primary schools are there, how many middle schools are there, how many secondary schools are there, then village wise drinking water sources in the districts. So this kind of information we are getting. And while preparing GPDP, BPDP and DPDP, this source can be utilized to know the number of villages which are not having minimum or basic amenities. So accordingly, we can prepare plan so that we can address their basic necessities and basic needs of the people. So this can be accessed by using this link. Then district handbook of statistics, it is also there. It deals with population, then public health facilities, then details of agriculture, including land utilization, block block-wise land holding. So this information we are getting out of this, and we can know how to access agriculture, irrigation, and public health status from this particular source, and it is useful for situation analysis. This data may be utilized for prioritizing or by or finalizing different activities. As you know, when you are preparing this GPDP, BPDP, or DPDP, there is a stage that is prioritization of activities. So this source can help us in prioritizing different activities. So this is the link to access this source. Then comes this Mission Antyodaya data. As you know, this Mission Antyodaya data, it is basically a framework that is dealing with convergence and accountability. There are 29 subjects and 143 parameters, and there has been a lot of discussion on this since today morning. So by uploading this raw data, we are getting these different reports, like specific reports, sector specific reports, general reports, gap reports. So this can be helpful while finalizing different activities. To minimize the gaps, we can undertake large number of activities at the Gram Panchayat level, Block Panchayat level, and District Panchayat level. So this can be accessed by using this particular link. Then this local government directory is there, as you know. So you can upload, we can download Gram Panchayat Development Plan, Block Panchayat Development Plan, and District Panchayat Development Plan by using unique and specific codes. Then you are having this, this can be accessed by using this particular link. Then spatial planning. As you know, the spatial planning, it refers to the methods and approaches used to influence distribution of people, connectivity, and activities in spaces of various scales. It aims at planned development. As you know, it avoids unplanned development in the rural areas. So this can be very much useful for preparing Gram Panchayat Development Plan, then Block Panchayat and District Panchayat Development Plan. Then the GIS-based plans. There are different sources of data here. If you see the benefits of GIS planning, it supports the decision-making process. Another thing is that it enhances the engagement of citizens. Citizens, they can involve themselves in the planning process, implementation process, and monitoring process. So it can be utilized in a proper way. So how to access this GIS data? This Gram Manchitra. As you know, this Gram Manchitra, it provides a lot of information with regard to rural infrastructure. Like, how many schools are there, where schools are located, where Anganwadis are located, where post office is located. So this kind of information, infrastructure related information, you are getting from this Gram Manchitra. Then Bhuvan Panchayat, basically a lot of information with regard to natural resource management. Okay, so all this information we are getting from this Bhuvan Panchayat platform, digital platform. So when you are going for professional scientific planning process, we can depend upon this GIS-based data or information. Yeah, these are the links through which you can access this Gram Manchitra and Bhuvan Panchayat portals. Then how it can be utilized? Basically, when you are thinking of this GIS-based sources of data, we can find out the location of different projects. We can find out the connectivity of all over the roads, actual length of the road. So accordingly, you can prepare perspective plan. As you know, it's a long-term plan with goal. So that can be prepared by utilizing this GIS-based data. Then another important source of data, that is GPDP. A lot of discussion has taken place with regard to how to use this GPDP. So GPDPs can be collected, can be consolidated at the block panchayat level. Then it can be analyzed properly to identify the gaps. Okay, accordingly, we can prepare this block development plans. Similarly, at the district level, we can collect and consolidate and analyze block panchayat development plans. Then accordingly, we can prepare the district panchayat development plans. So this way, this gram panchayat development plans can be utilized. As Secretary Sir has already mentioned, we are putting a lot of effort while preparing gram panchayat development plan. We are collecting data by engaging facilitators. We are engaging community to collect primary data. So that should not go waste. So when you are preparing block panchayat development plan and district panchayat development plan, you have to rely upon gram panchayat development plan. And we are telling from time to time, block panchayats and district panchayats, they may not go for collecting primary data because it is already collected by gram panchayat, by the community. So they have to depend upon this secondary sources of data, and accordingly professional and scientific plan can be prepared at block level and district level. So then data from line departments. Yes, yes. Okay, ma'am. So yeah, that's all. Okay, thank you. Thank you. Thanks a lot. Yeah. Thank you.
Thank you, sir. Our next presentation is on localizing of SDGs in Panchayat planning by Srimati Jayashri Raghunandan, Additional Chief Secretary, Tamil Nadu. Madam will be joining us online. By Srimati Jayashri Raghunandan, Additional Chief Secretary, Tamil Nadu. Madam will be joining us online.
Good evening.
Yes, good evening, and this is going to be quite a technological challenge. So let's see how it goes. Very good evening to all my colleagues from different states and to those who are also on the YouTube watching it like me through the day. From the morning, I've been also listening to all the speakers and from the ministries and also the participants. It's been an excellent discussion and so many points that have come up, and in the last session by the Secretary MOPR, he had summarized the whole thing and urged everybody in the best way I know that he can. He's one of the finest, and I do hope that things will move towards what is expected from all of us in relation to the SDGs. And so in this context, I thought, let me try and give you something which would be a little different from what you have had for the whole day. And in that context, I would also like to, tell you or ask you to think about in which way are you going to make this PPC campaign different from the ones that you have done before. There were so many points that have been brought up and that have been given as directions, as ideas that can be taken forward, which would probably make a huge difference to the way
the PPC is done this time. And I would just also mention that if you do the same thing the same way as you've done before, you'll get the same results. It's not new, I think all of us know it. So maybe we should see as to what we can do differently. And so in coming to the SDGs, as was told by the Secretary MOPR, that this time there'll be a greater focus on SDGs. So to start with, I would ask Vamsi, can you please play the first video which I have sent you? We have the sound.
Since the SDGs were agreed and the Paris COP21 agreement, enormous commitments have been made. In 2016, the world pledged $13 billion for the Global Fund for HIV/AIDS, tuberculosis and malaria. And $75 billion for the International Development Association of Culture. In 2017, the historic agreement for the world's oceans, as well as the Family Planning Summit and the Global Nutrition Summit. And in 2018, the Global Partnership for Education announced $112 billion.
I think this was the
goals have also been
challenge
adopted by a wide variety of partners. The private sector is realizing the opportunity. Sustainable business could unlock more than $12 trillion. Up to 250,000 civil society organizations are working for the goals. And the UN itself is making historic reforms towards a new system, enabling country teams to deliver and report on results in line with national needs and priorities. SDGs, every single day is important. In order to leave no one behind,
So I am not sure whether you were all able to hear this. Kadiresan, would you be able to tell me whether...
Yes, ma'am, we can hear you. Please.
No, you can hear me. Did you hear the video?
Yes, ma'am, everything is clear.
Okay, great. Because I couldn't hear it at this end. So I would think, from this, it is something which is happening everywhere. There is so much that's happening. And one should be able to feel that there is so much on SDGs that's going on, and the vibrancy and the constancy with which it needs to happen. Whether youth, women, children, at the GP level, at the block, and the district level. So this is something about SDGs, which usually we would look at it as, okay, localizing SDGs is something as an add-on, but we would like you to start the feel as to what it is. Can you play the next one, please? I hope the volume is good for you people.
was refugee in Pakistan, I was refugee in Iran, I was refugee in Dubai, and now I'm a refugee in France.
Les gens, quand tu es handicapé, ils n'essaient même pas de voir ce que tu es capable de faire, mais ils te jugent à travers ton handicap.
Haberme venido no fue una buena idea.
यहाँ की लड़कियां कुछ नहीं कर सकती।
लाइट रहे तने उजियार रहे हमरो बाल बचा उजियार रहे
Aga mami fumidam bini sabnami bem mushkilnami kharta.
Porque se todo mundo tivesse alimento em casa, ela podia raciocinar. Então, poderia ser pobre, mas teria inteligência na cabeça para poder sair dali.
Parce que na mukil mutu azwana mission na onzamba tindelai. Ngape na za mukil pona mission na ngai me nzambe ndayebi.
I've left my husband to be with a woman, and for me that's a huge step in my country as an African woman to do that. I do have a strong voice and I'm strong as a woman speaking for myself.
Nous devons dire au monde que nous existons, que vous êtes là. Et je suis sûr qu'aucune misère, aucune pauvreté extrême n'est pas une fatalité. On peut la combattre.
Afaka ihany fa mba tsy hitovy amin'le hoe toerana nisy atsony zany fa mba lasa ambonimbony koa zany izy dia tamin'ity ny reniny dia fa mihina teo zany any an-tendrony any.
So when you're looking at the GPDP that is being prepared and the PPC that is coming up, how does Panchayat planning address this? How does it address those who are the furthest? And this year and a half more has been very challenging with the COVID and its impact, and I think it's affected us in various ways. And the recovery from it as well is very challenging. And many of us are aware of this, and I'd like you to see one more video on what it is for women. Can you play the next one, please? I think while I think Secretary had repeatedly talked about the attention to buildings, the attention to those which are most seen. And here we have this entire issue which we know is there, mostly unseen. And this is where the panchayats and a part of the localizing SDGs can look at and how they can address violence against women and children. And as we often hear, it's time we really take this chance to build back better now. Can you play the next one, please? So, in the GPDP that is planned, what is that which is for women and for children? What is the portion which goes as a gender budget or which goes as a child budget? And what does it try to address? Perhaps these are questions which can be asked in the panchayat to have a look at. And there was this talk, and I think all of us are aware of climate change. Can you play the next one, please?
With further warming in the coming years, we expect to see new extremes that are unprecedented in magnitude, frequency, timing, or in regions that have never encountered those types of extremes.
You've been telling us for over 3 decades of the dangers of allowing the planet to warm. The world listened, but didn't hear.
It is unequivocal that human influence has warmed the atmosphere, ocean, and the land. We confirm that human-caused emissions of greenhouse gases are the main driver of global warming.
Climate change is here now, but we are also here now. And if we don't act, who will?
So I think climate change is a matter of concern for everybody, and the panchayats and the greenhouse gas emissions is something which some of us probably weren't too aware of, as to livestock is also a considerable contributor to it. It seems to be almost that we think everything is urban and nothing is rural. So how can the panchayat work with the Department of Environment and Forests? And we should try and see how much we can draw in other departments to work, or go to them and ask them as to what is it that we can do about this issue. And so there's a lot of awareness and action which can be taken at the panchayat level on climate change. And all of us are aware of the flooding, of the cyclones, and the frequency of rains. One doesn't have to really repeat all of that. But I would think that the urgency of action is something which SDGs try to convey. And at the panchayat level, when we talk of every village, I think it'd be good to see the next video on it. You play the next one, please. we're working on the GPDP and we talk about leaving no village behind, it's not just those villages which are doing very well, but in fact those villages which aren't doing so well. And on the last video that I would want to show you, this is about the UN Decade for Action, which has already started, and we're already a year beyond that decade. Can you play the last one, please?
I have never seen so many people so animated around the Sustainable Development Goals as during the past 3 days. From the SDG Action Zone on our lawn to billboards in Times Square, the SDGs are everywhere as they should be. We started this journey together in 2015 and we know our destination. Opportunity for all on a healthy planet. In short, we have set our sights on a fair globalization. The good news is that the 2030 agenda is coming to life, and we are making progress. But let us be clear, we are far from where we need to be. We are off track. That is why today, as requested by our political declaration, I'm issuing a global call for a decade of action to deliver the Sustainable Development Goals by 2030. Tout d'abord, l'action à l'échelle mondiale. Le temps est venu de prendre des décisions audacieuses, tant sur le plan individuel que collectif. Il nous faut davantage de ressources. En deuxième lieu, l'action locale. Nous devons faire davantage au niveau national afin d'obtenir des résultats là où cela importe le plus, dans la vie des gens. Troisièmement, l'action individuelle. J'appelle la société civile, les associations locales, les médias, le secteur privé, les syndicats et les universités, entre autres, à plus que jamais travailler, mais main dans la main, vers des objectifs communs. We have the best solution in the Agenda 2030, our blueprint for a fair globalization. We must step up our efforts, and we must do it now.
Thank you, Vamsi. I think that's the last of the videos that I wanted to show you. It was a pretty quick run through so much of what would be things which would really get into our minds, into how we feel, and it was something which the Secretary MOPR was talking about, the impact that videos can have and how you can reach people. And as was last said by the UN Secretary General, people coming together, the People's Plan campaign that is there towards Panchayat planning. The role of PRIs, I think, is something which is on local government, which all of you would know. It is, and beyond that, in today, if you'd see, it's all the departments. So who's supposed to be responsible for localizing SDGs? Is it only the PR department, Panchayati Raj department? I'm sure all of us understand that it is everybody's baby. Everybody has to work on the localizing of SDGs. In fact, all departments have so much that they are doing which are actually impacting or taking the SDGs forward. So from a whole of government, we move on also to a whole of society approach. And when you look at it, like you are today having the Mission Antyodaya indicators, the survey, the data, and he was talking about how data can be very useful. In doing SDGs, there is, as all of you would be aware, there is the SDG India Index, which is done by Niti Aayog. And in localizing SDGs, we need certain measures, certain targets and indicators which would enable us to understand where the panchayat is moving on the SDGs and their relevance to the panchayat. And it needs to be revisited regularly. It is not something which is, say, done once a year. But the thing like SDGs is something which is almost all the time. So it's a perspective as to how you're looking at it. Are we looking at it from a departmental perspective, or are we looking at it from people's perspectives? So I would think that here's something where you feel for it. If you can create that fire and passion towards working for it, it would make a huge difference. So in this, I think when we look at how panchayat planning and SDGs get linked, it is how we convert promises into reality. How you ensure that you leave no one behind. how you address issues such as violence against women, gender equality, climate change, COVID recovery, which is very important, and that we need to do it now. We need to do it together and constantly. It's not a one spell, not just the PPC for the preparation of the GPDP, but a PPC which is constant, which keeps happening for theme after theme, for work after work on the SDGs, because there is so much to do. You can always use the national days and international days and work with the department for it as to what they want to communicate in the panchayats, so that a certain a camaraderie, a convergence takes place between what they are doing and what the panchayats. They're all wanting the same thing. And so what the plans are, I would think, is a trust that what we are doing is for the future. And that's what the SDGs are about. So I'd like to thank NIRD and the Ministry of Panchayati Raj for giving this opportunity to address all of you on localizing of SDGs, which I hope that it's given some feel to all of you as to what it is. Thank you.
Thank you, ma'am. Thank you for joining and giving a wonderful live audio-based, video-based session.
I hope it was heard well there. I was in silence out here.
No, it was very clear, ma'am. I think we had a good interaction. Thank you. Thank you for joining. Yeah.
Thank you very much.
So we'll go to the last session. So now we'll come to the final session of the day today. So almost we completed all the sessions and this thing. Now we'll invite respected Secretary Modi sir, respected Secretary MOPR and our DG NIRDPR sir to come on to the dais to give their concluding remarks. Sir, please. Light on.
Now, may I request Shri Nagendra Nath Sinha, Secretary, MOPR, to give the concluding remarks first.
So I have colleagues on the dais and colleagues in the house. It's unfair on my part to conclude because I have not been there for most part of the day. I've been with the state governments reviewing the rural development programs and with the faculty of the NIRDPR. But looks like there is considerable enthusiasm for the work, though some colleagues in the audience have disappeared, so to say. I see about 2/3 presence as compared to what we saw in the earlier session. But I think, be that it may, as it may, some people may have had to catch the flight. The fact remains that People's Plan campaign is the only campaign which has the potential of as was mentioned by previous speaker, Dr. Jayashree Raghunandan, and must have been reiterated throughout the day, that it is the only way in which the wholesome aspirations of the rural population can be addressed, not by individual programs alone. Just before this session, I was addressing the faculty members on how different programs are addressing the SDG and how should we map programs to different SDGs, or should we map SDG to different programs. So I my words of advice were that we have to work backwards from the SDGs rather than from programs to SDGs. So our programs are only an end to the means of achievement of the SDG and the development goals and aspirations of the people, and if you work on them diligently as per the wisdom of the local people, as per the aspirations of the local people as reflected in the Gram Sabha and the Gram Panchayats at various tiers, I think it's going to make a mark. The template in which these have to be implemented has already been laid down very clearly in the initial presentations and must have been reiterated by colleagues throughout the day. So please implement them as diligently as possible. I've also requested Dr. Narendra Kumar to kind of make, I got kind of a series of videos so that those of whom who are not able to get the instruction and orientation from the training programs that the state governments and the SIRD would be organizing, they can draw appropriate lessons from the programs that NIRD and PR may be creating. So nothing more to say. Wish you best of luck, and let's hope that the rigor of the program and the plans that you draw improve, the participation of the people increases, the participation of the departments improves, the documentation is captured at the earliest, and it does not remain a mere wish list, but it becomes an effective plan of action of improving the situation of the rural population, and that gets monitored year after year and periodically, and really improves the face of the rural areas and is able to bridge the rural-urban divide. So with these words, I'll conclude and wish you again best of luck and safety, health.
Thank you, sir. Now may I request Shri Sunil Kumar, Secretary, Ministry of Panchayati Raj, for concluding remarks.
I've already spoken.
Yes, sir, but we would like to hear the concluding remarks as well.
All colleagues present here, both on the dais as well as in the auditorium. As I mentioned in the session prior to this, just immediately preceding the one on SDGs, I had spelt out in considerable length the way forward, how we need to carry this People's Plan campaign forward in the next 4 months, what needs to be done and how we can do it. And of course, taking into account the state-specific conditions and realities, ground realities, into account. So I don't intend to add more to that, but I must say that the last session on SDGs, which was presented by Jayashree Raghunandan ma'am from Tamil Nadu. First of all, compliments to the NIRDPR team. It went off without a hitch. We were able to see the videos as well as the picture very clearly, unlike the fiasco which we had in the morning session when Department of Drinking Water Supply presentation couldn't come out or go through so effectively. So that's a good coordination between the technical team of NIRDPR and the people who were there in Chennai. So that went off really well, and it also shows that when we are speaking of having more of these hybrid sessions in future, that yes, these things are possible, and we can reach out to a large number of people. And I'm sure that today, if there are 100-odd people here in the auditorium, maybe the people who have watched this day-long workshop on YouTube, as Jayashree ma'am was mentioning, would run into an equally large number, if not more. So this is the way to go forward. And we have to now look at this People's Plan campaign as to how we can enable the local people, present before them various options, various opportunities, so that they can take a considered decision as to how they intend to go forward. That is the challenge before us. All of us have to don the role of facilitators. We cannot be dictating to them, okay, look, this is the plan that is required. If you have to spend so much money, you have to put it down in this document, that's why you do it. Rather, they should be taking matters in their own hands, deciding for themselves as to what is good for them. And ultimately, it's a question of not only survival. When we talk of sustainable development, the issue of survival is also at stake, but also of providing a life with dignity to each and every individual, each and every human being. So that is the challenge before us. We have to take into account the issues of gender, class bias, marginalized sections, and address their requirements, their issues to the best of our ability. And the local governance institutions, they provide the best means for doing that, for addressing those. And as all of us who are sort of prime, both frontline workers of Rural Development Department and Panchayati Raj functionaries, we have been entrusted this major role. So it provides a very major role through which we can impact positively lives of thousands and lakhs of crores of citizens. So that's a huge opportunity that we have. Let's work, build on our successes, build on our achievements, the strong foundation that has been laid, and ensure that in the days to come, the People's Plan campaign is a roaring success on each and every parameter that can be visualized not only by those who are in government, but also those who are outside. So that is the challenge before us, and I'm sure that with the cooperation of all of you, all the staff and faculty of NIRDPR, the SIRDs, we would be able to do a good, decent job of it. Wish you all the best. Thank you.
Thank you so much, sir. Now may I request Dr. Anjan Kumar Bhanja, Associate Professor, NIRDPR, to give vote of thanks.
Yeah. Good afternoon, everybody. Respected Secretary MORT, respected Secretary MOPR, DG NIRDPR, DDG NIRDPR. So I'm really privileged to propose vote of thanks before this august audience, which includes august dignitaries and august participants. I'm really extremely grateful to Sri Nagendra Nath Sinha, Secretary MORT, for delivering inaugural address and sharing his thoughts, which have definite takeaways that will help in achieving the overall objective of this year's People's Plan Campaign 2021. As you know, he has highlighted on livelihoods and employment agenda that have to be owned by panchayats. He also highlighted on equity in Gram Sabha. Then he also highlighted natural resource and climate change management by PRIs. This is the need of the hour. He also highlighted about the operation and maintenance of facilities by PRIs. Sir, we are thankful to you, sir. I take this opportunity to express my sincere thanks to Sri Sunil Kumar, Secretary MOPR, for his inspirational and motivational keynote address, which truly captures the spirit of the PPC. Sir, the ideas shared by you in your way forward session will serve as a pathway in these challenging times. Sir, your most important ideas include vibrant Gram Sabha with at least 10% attendance of electors. You also highlighted about the nexus of Mukhiya and Secretary is to be broken for effective Panchayat functioning. You again highlighted OSR, own source of revenue, has to be generated to meet the demands of the villages. So basically these are the most important things which Gram Panchayat has to do. I want to express my heartfelt thanks to Dr. G. Narendra Kumar, Director General NIRDPR, for delivering welcome address and providing necessary leadership for making this particular program successful. Dear participants, we could able to organize this event smoothly immediately after a long weekend due to strong and timely support provided by Director General, sir. I am really thankful to you, sir. You have already highlighted the integration of plans, among all these three tiers, Gram Panchayat, Block Panchayat and District Panchayat. You also highlighted about the quality of plan. Instead of focusing on quantity of plans, we have to also focus on this quality of plans. I must express my deep gratitude to Dr. Chandrasekhar Kumar, Additional Secretary, Minister of Panchayat Raj, for setting the context for this year's People's Plan campaign. His ideas will definitely serve as a guiding light for this year's People's Plan campaign. He highlighted on the essential use of PFMS. He says, if we fail to plan, then we are planning to fail. That is true in this situation. And again, he highlighted that if GPDP, Gram Panchayat Development Plan, is good, then Block Panchayat Development Plan and District Panchayat Development Plan are bound to be good. Then he also highlighted that the Gram Panchayats, they have to go for sectoral analysis of plans and gap analysis, based on the mission on the gap report. So like this, many things, he highlighted that I don't want to, highlight all these points here. Then I express my sincere gratitude to Srimati Rekha Yadav, Joint Secretary MOPR, for presenting an overall view of this year's People's Plan campaign and setting the tone for this orientation workshop. Thanks for sharing your insightful thoughts, ma'am. If I highlight some of your views, you highlighted that holistic planning is possible with the involvement of community. So when you are thinking of comprehensive and holistic GPDP, BPDP and DPDP, you have to involve the community. It should be a community managed, community based and community owned plan. And it is necessary to expedite the process of moving from wish list in GPDP to executable list of activities. You highlighted that. So, and again, you also highlighted the moving ahead of from quantity to quality of plans. So we are really thankful to you, ma'am. I want to express my sincere thanks to the luminaries from 9 ministries like Srimati Nita Kejriwal, Joint Secretary, Minister of Rural Development, Sri Manish Garg, Joint Secretary, Minister of Education, Sri Atul Kotwal, Executive Director, Minister of Health and Family Welfare, Sri Chandrasekhar, Director of MSME, Dr. C.P. Reddy, Additional Commissioner, Department of Land Resources, and Sri Arun Baroka, Additional Secretary, Department of Drinking Water and Sanitation, for sharing their insightful views and shedding the light on their relevance in the decentralized planning. I want to express my thanks and I appreciate the participation of participation from Maharashtra, Kerala, Himachal Pradesh, Chhattisgarh, and they share their views and experiences of last year's PPC. It was really challenging for all the states to undertake PPC-related activities last year, but in spite of various hurdles, you have made some tremendous achievements in your respective states, and this will definitely serve as an inspiration to all of us. I want to thank Srimati Jayasri Raghunandan, Additional Chief Secretary, Government of Tamil Nadu, for sharing her thoughts and ideas on localizing SDG, which is one of the core focus areas of Gram Panchayats. Thanks a lot, ma'am, for your insightful session, which includes large number of inspirational videos also. I want to convey my thanks to Register NIRDPR, DDG NIRDPR for their timely support to make this particular program successful. I want to thank all the participants who have taken out their time from their busy schedule to attend this national level orientation workshop and making it a huge success through their active participation.